The fluorescent lights of Stillwater Veterans Hospital flickered as a woman in a gray custodian's uniform knelt on the emergency room floor, her gloved hands buried inside a dying soldier's chest. Blood pooled around her knees. Doctors stood frozen against the walls. She wasn't supposed to be here. She wasn't even supposed to touch patients. But 30 seconds ago, when every certified surgeon in the room had given up, Katherine Brennan, age 67, employee badge reading sanitation staff, had walked through that door like she owned it. And now, with her fingers wrapped around a failing heart, applying pressure no textbook had taught in 40 years, she was about to remind everyone why the military had once called her the Ghost. Because ghosts don't die. They just wait for the right moment to come back. Before we dive into Katherine's incredible journey, I need your help. Please follow this story all the way to the end, hit that like button, and drop a comment telling me what city you're watching from. I want to see just how far this story can travel across the world. The thing about being invisible is that you hear everything. Katherine Brennan heard the residents gossiping about weekend plans while she mopped blood from examining room 3. She heard the charge nurse complaining about understaffing while she emptied biohazard containers. She heard Dr. Marcus Webb, chief of emergency medicine, 42 years old, Stanford educated, impossibly confident, telling his intern that real doctors didn't waste time learning outdated field techniques because modern medicine had evolved beyond battlefield barbarism. She kept mopping. Stillwater Veterans Hospital sat on the edge of Fort Dalton in Clarksville, Tennessee, a sprawling complex that treated everyone from active duty personnel to retired veterans to civilian contractors. Katherine had worked here for 11 months as part of the environmental services team. She arrived at 5 in the morning, left at 1 in the afternoon, and spoke to almost no one. Her supervisor, a perpetually exhausted man named Dennis, once told her she was the best custodian he'd ever hired because she stayed in her lane. She hadn't bothered correcting him. It was a Tuesday in late September when everything changed. Katherine was restocking paper towels in the surgical wing when she heard the commotion downstairs, raised voices, running footsteps, the distinct hydraulic hiss of a gurney moving too fast. She glanced at the clock. 8:47 hours. Training exercises at Fort Dalton usually wrapped by 7:30. Something had gone wrong. She moved toward the stairs. "Hey!" Dennis called from down the hallway. "Those aren't your floors today. Stick to post-op." Katherine nodded but didn't stop walking. She descended 2 flights, pushed through the double doors into the ER corridor, and immediately assessed the chaos unfolding in Trauma Bay 2. A young soldier, early 20s, combat fatigue soaked in dirt and sweat, lay unconscious on the gurney while Dr. Webb barked orders at a team that looked one step away from panic. "Pupils unresponsive. BP is 70/40 and dropping. Get me 2 units of O negative now. Where the hell is respiratory?" Katherine stood in the doorway, unnoticed, her mop bucket abandoned in the hall. She watched Dr. Webb's hands as he attempted to secure an airway. Too much force, wrong angle. He was fighting the patient instead of working with him. The soldier's lips were turning blue. A nurse, young, maybe 26, fumbled with the IV line. "I can't get a vein, doctor. He's too dehydrated." "Then find one," Webb snapped. Katherine's eyes moved to the monitor, heart rate climbing dangerously, oxygen saturation at 82% and falling. The kid was coding, and nobody in that room seemed to realize it yet. She took 1 step forward. "Excuse me," she said quietly. No one turned. "Excuse me," she repeated, louder. Dr. Webb looked up, his face flushed with frustration. "We're in the middle of a code. Whoever you are, you need to leave." "His airway's collapsing," Katherine said. "You're pushing too hard. Hyperextend the neck, jaw thrust, and use a smaller tube." For 3 seconds, nobody moved. Then Dr. Webb's expression hardened into something between disbelief and offense. "Are you seriously trying to tell me how to intubate? I'm telling you that soldier's about to die if you don't listen." "Security!" Webb shouted without breaking eye contact with her. "Get this woman out of my trauma bay." But the young nurse, her name tag read Sarah Lynn, hesitated, glancing between Katherine and the monitor. "Doctor, his O2 sat is at 79. I can see the damn monitor. Someone get her out." The flatline alarm screamed to life. Every head in the room snapped toward the sound. The soldier's body went rigid, then slack. The monitor showed a chaotic zigzag of ventricular fibrillation. Starting compressions. Sarah Lynn threw herself onto the gurney, hands stacked on the soldier's chest. Charge the defibrillator to 200, Webb ordered. Katherine stepped fully into the room. That won't work. I said get her out. He's not in VFib. Look at the waveform. That's artifact from muscle tremors. His heart's still beating, but the electrical signal's failing. You shock him now, you'll stop the only rhythm he has left. Dr. Webb's jaw clenched so hard Katherine could see the muscle jumping in his cheek. But Sarah Lynn had stopped compressions and was staring at the monitor, her face pale. She's right, Sarah Lynn whispered. Oh my God, she's right. It's tremor artifact, not fibrillation. That's impossible, Webb said, but his voice had lost its certainty. Katherine moved to the side of the gurney. You want to save him, or you want to be right? For one terrible moment, she thought he was going to choose his ego over the patient's life. Then Webb stepped back, his face a mask of barely controlled fury. Fine, he said through clenched teeth. Show me what you think you know. Katherine stripped off her custodian gloves and grabbed a sterile pair from the wall dispenser. Her movements were economical, practiced, muscle memory rising from places she'd thought were buried. She repositioned the soldier's head with a gentleness that contradicted the urgency of the situation, felt for landmarks Webb had missed, and slid the endotracheal tube home on the first attempt. Bag him, she told Sarah Lynn. 8 breaths per minute, normal tidal volume. Sarah Lynn obeyed without question. Katherine's hands moved to the soldier's neck, fingers finding the carotid pulse. Weak, but present. She grabbed a stethoscope from the crash cart and listened to his chest. Breath sounds on the left were diminished. Possible pneumothorax, but not tension. Not yet. He needs a chest tube, she said. Left side, 4th intercostal space. And get me calcium gluconate, 1 gram IV push, and a magnesium bolus. Now. Dr. Webb had gone very still. How do you know? Because I've seen this before. Katherine looked up at him. Heat exhaustion combined with electrolyte imbalance and pre-existing cardiac arrhythmia. Classic presentation in soldiers who've been overtraining in humid conditions without proper hydration protocols. The tremors mask the EKG, which makes it look like VFib when it's actually just a failing sinus rhythm. You stabilize the electrolytes, correct the underlying hypoxia, and the heart sorts itself out. That's... Webb trailed off, staring at her like she'd just spoken in a language he didn't recognize. Impossible? Katherine offered. Or just something they don't teach at Stanford anymore? She didn't wait for an answer. She turned to Sarah Lynn. Did you get those medications? Right here. Sarah Lynn's hands were shaking as she handed over the syringes, but her voice was steady. Katherine administered the calcium first, watched the monitor, then followed with magnesium. The tremors began to subside within seconds. The jagged waveform on the EKG smoothed into something closer to normal. Not perfect, but alive. The soldier's oxygen saturation climbed. 85, 90, 94. His eyes fluttered open. Welcome back, Katherine said quietly. The young man tried to speak around the breathing tube, panicked, and Katherine put a hand on his shoulder. Easy. You're at Stillwater Veterans Hospital. You collapsed during training. We've got you. His body relaxed slightly, trusting her in a way that only soldiers knew how to trust. Dr. Webb finally found his voice. Who the hell are you? Katherine stepped back from the gurney, peeling off the gloves. I'm the woman who mops your floors. Bullshit! Webb's voice was sharp, but no longer entirely hostile, more confused than angry. No janitor knows how to read an EKG like that. No janitor knows field medicine protocols that specific. Maybe you should hire better janitors. Before he could respond, the trauma bay doors burst open and 2 MPs strode in, followed by a woman in a crisp army uniform with oak leaves on her collar. Lieutenant Colonel. Katherine didn't recognize her, but she recognized the type. Career officer, mid-40s, the kind of person who'd memorized every regulation manual and expected everyone else to do the same. What's the status? The colonel demanded. Dr. Webb gestured helplessly at the stabilizing soldier. He's stable. We almost lost him, but this woman saved him, Sarah Lynn interrupted, pointing at Katherine. The colonel's eyes landed on Katherine, and something shifted in her expression. Not recognition exactly, but a spark of interest. Your hospital staff? The colonel asked. Environmental services, Katherine said. She's a janitor, Webb clarified, his tone making it sound like an accusation. The colonel studied Katherine for a long moment. What's your name? Katherine Brennan? Former military? Katherine hesitated, then nodded once. Army. Medical Corps. Discharged 14 years ago. Rank? Captain. That got everyone's attention. Sarah Lynn's eyebrows shot up. Dr. Webb looked like someone had just told him the laws of physics had been repealed. The colonel extended her hand. Lieutenant Colonel Denise Whitmore, base commander for Fort Dalton Medical Facilities. Her handshake was firm, professional. Captain Brennan, I'm going to need you to come with me. I still have floors to finish, Fess. The floors can wait. Whitmore's voice carried the weight of someone who didn't make requests, only gave orders that sounded polite. We need to talk about what just happened here. Katherine glanced at the soldier on the gurney, now breathing steadily, color returning to his face. Mission accomplished. She'd done what needed doing. Now came the part she'd been dreading for 11 months, questions she didn't want to answer about a past she'd worked hard to bury. Give me 5 minutes to put away my equipment, Katherine said. 2 minutes, Whitmore countered, and bring your employee file. Todd, the base commander's office was exactly what Katherine expected. American flag in the corner, framed commendations on the walls, a desk that was too clean to belong to someone who actually worked there. Whitmore sat behind that desk, reading something on her computer screen with an expression that gave away nothing. Katherine stood at parade rest without thinking about it, muscle memory taking over. Sit, Whitmore said without looking up. Katherine sat. Whitmore clicked her mouse a few more times, then rotated the monitor so Katherine could see it. Military service record. Katherine's service record, pulled up faster than should have been possible if she'd been looking at public databases, which meant Whitmore had access to classified personnel systems. Captain Katherine Ann Brennan, Whitmore read aloud. 3 combat deployments. Iraq, twice. Afghanistan, once. 15 years of service with the Army Nurse Corps, specializing in trauma and emergency medicine, awarded the Bronze Star, 2 Army Commendation Medals, and a Combat Medical Badge. She looked up. Says here, you left the service in 2011 with an honorable discharge. Care to tell me why a decorated combat nurse is mopping floors in my hospital? I needed a job, Katherine said simply. You could have gotten a job as a nurse. Any hospital in the country would have hired you with your credentials. I tried that. And? Katherine met Whitmore's eyes. Turns out being good at keeping soldiers alive in a forward operating base doesn't translate well to civilian emergency rooms. Different protocols, different equipment, different pace. I couldn't adapt fast enough. And after the 3rd hospital decided I was too aggressive in my treatment approaches, I stopped trying. So you became a janitor. I became employed. Whitmore leaned back in her chair, studying Katherine like a puzzle that wasn't fitting together correctly. You're wasted in environmental services. I'm employed in environmental services. What I saw downstairs wasn't the work of someone who's forgotten how to practice medicine. That was someone who never stopped being a combat medic, even if she wasn't carrying the title anymore. Katherine said nothing. Here's my problem, Whitmore continued. I've got an emergency department that's chronically understaffed, and a chief physician who, while competent, doesn't have experience with the kind of trauma cases we see from active training exercises. What happened this morning could have been a fatality. Would have been, if you hadn't been there. Dr. Webb would have figured it out eventually. Would he? Or would that soldier be in a morgue right now while Webb wrote up his report about how he did everything by the book? Katherine didn't answer because they both knew the truth. Whitmore pulled a folder from her desk drawer and slid it across to Katherine. I want you back in medicine. Starting next week, you'll be working as a civilian contractor in the emergency department, reporting directly to me. We'll start you at a GS-11 pay grade. That's roughly equivalent to what you were making as a captain, adjusted for inflation. You'll have full access to the ER, trauma surgery, and critical care units. Katherine stared at the folder without touching it. Dr. Webb will never agree to this. Dr. Webb doesn't get a vote. This is a military hospital on a military base, and I'm the ranking officer. If he has a problem with my staffing decisions, he can take it up with the Pentagon. And what makes you think I want to go back to medicine? Whitmore's expression softened slightly. Because 20 minutes ago, when you walked into that trauma bay and saved a soldier's life, I saw something in your eyes that I haven't seen in a long time. You weren't scared. You weren't hesitant. You were home." The words hit harder than Katherine wanted to admit. She looked down at the folder, then back up at Whitmore. "I'm 67 years old, Colonel. I'm not the nurse I used to be. You saved a life this morning that multiple younger, more current medical professionals were about to lose. I'd say you're exactly the nurse I need." Whitmore stood, signaling the meeting was over. "Take the folder, read through the contract, think about it, but I need an answer by Friday." Katherine picked up the folder, feeling its weight. "And if I say no, then you go back to mopping floors. And the next time a soldier dies because someone missed something obvious, you get to live with the knowledge that you could have prevented it." Whitmore walked to the door and opened it. 3 days, Captain Brennan. Use them wisely." Katherine didn't go back to work that afternoon. She told Dennis she wasn't feeling well, which wasn't entirely a lie, and drove to the apartment she'd been renting for the past year on the outskirts of Clarksville. It was a nothing place. 1 bedroom, thin walls, furniture that came with the lease. She'd never bothered to decorate because she'd never planned to stay long enough to care. She made coffee, sat at the kitchen table, and opened the folder. The contract was straightforward. Civilian medical contractor, Emergency Services Division, 1-year renewable term, benefits included. Malpractice insurance covered by the government. Starting date, next Monday. All she had to do was sign. She thought about the last time she'd worked as a real nurse. Not just someone playing janitor while her brain cataloged symptoms and diagnoses she wasn't allowed to treat. Detroit, 2012. A Level 1 trauma center that had recruited her specifically because of her combat experience. They'd promised her she'd be an asset, that her skills were exactly what they needed. It lasted 4 months. The problem started small. She moved too fast, other nurses said. She was too direct with patients. She didn't follow the chain of command when she saw something that needed immediate intervention. And then came the incident that ended it all. A car accident victim, multiple traumas, going into shock while the attending physician was on the phone arguing with insurance about whether they were authorized to do an emergency splenectomy. Katherine had taken one look at the patient's declining vitals, grabbed the surgical resident, and told him they were going to the OR immediately. They'd saved the patient's life. And Katherine had been fired 3 days later for overstepping her authority and undermining the attending physician's decision-making process. After that, she'd tried 2 more hospitals. Same story, different cities. Combat nurses operated on a different frequency than civilian medicine allowed. They were trained to make life or death decisions in seconds, without committees or consultations or insurance approvals. That kind of instinct didn't translate well to environments where liability mattered more than outcomes. So she'd stopped trying. Found work that didn't require her to watch people die while administrators debated proper procedure. Became invisible. And then this morning, for just a few minutes, she'd been visible again. Her phone rang. Unknown number. She almost didn't answer, but something made her pick up. "Miss Brennan?" A woman's voice, young, uncertain. "This is Sarah Lynn Kowalski, from the ER. I hope you don't mind. I got your number from the employee directory." "What do you need, Sarah?" "I just wanted to say thank you for earlier. I've been a nurse for 3 years and I've never seen anything like what you did. The way you just knew. How did you know?" Katherine closed her eyes. "Experience. Dr. Webb's been in his office all afternoon. He hasn't said a word to anyone, but I heard he looked up your service record. I think you scared him." "I didn't mean to." "No, I mean, you scared him because you made him realize how much he doesn't know. He's a good doctor, but he's never worked trauma like you have. None of us have." Sarah paused. "Are you coming back? To work in the ER?" "I don't know yet. I hope you do. We need someone like you." Another pause, longer this time. "That soldier you saved? His name is Private Devin Fletcher. He's 23. He's got a wife and a 6-month-old daughter. He would have died today if you hadn't been there." Katherine opened her eyes and looked at the contract on the table. "Thank you for calling, Sarah." She hung up before the young nurse could say anything else. Devin Fletcher, 23 years old, wife and daughter. The soldier Katherine saved in Iraq during her second deployment had been 22. His name was Marcus. He'd bled out in her arms despite everything she'd done because she'd been working in a field hospital with limited supplies and no backup. She still remembered the exact shade of his eyes when the light left them. She picked up a pen, but before she could sign the contract, her phone rang again. Different number, also unknown. Katherine Brennan, she answered. Captain Brennan, this is Dr. Marcus Webb. His voice was stiff, formal. I think we need to talk about what happened this morning. I'm listening. Not on the phone. Can you meet me at Murphy's Bar on Riverside Drive, 7 o'clock? Katherine glanced at the clock. It was almost 5 now. Why? Because I owe you an apology, and I'd rather do it in person. He sounded like the words were being extracted with pliers. And because Colonel Whitmore told me you're being offered a position in my department, and if that's happening, we need to establish some ground rules before you start. I haven't decided if I'm taking the position. Then maybe this conversation will help you decide. 7 o'clock? I'll be there. She hung up and stared at the contract for another long moment. Then she folded it, put it back in the folder, and went to change out of her custodian's uniform for the first time in 11 months. Murphy's Bar was exactly the kind of place military personnel went when they wanted to drink away from the tourist spots. Dim lighting, scarred wooden tables, a jukebox that probably still had songs from 1987. Dr. Marcus Webb sat in a corner booth, already working on what looked like whiskey. Neat. Katherine slid into the seat across from him. You started without me. Long day. He gestured to the bartender, who brought over another glass and a bottle. Drink? I'm listening first. Webb poured himself another measure, downed half of it, then set the glass down carefully. I was wrong this morning. The way I spoke to you, the way I dismissed what you were trying to tell me, that was unprofessional and dangerous. If I'd listened to you immediately instead of wasting time on my ego, we could have stabilized Private Fletcher 30 seconds faster. He lived. That's what matters. It matters that he almost didn't because I was too arrogant to hear what a janitor was trying to tell me. Webb's jaw tightened. Except you're not a janitor, are you? You're a decorated combat nurse with more field experience than anyone in that hospital, and I treated you like you didn't know the difference between a mop and a scalpel. You didn't know. I should have. The second you started talking, I should have heard the authority in your voice and realized you knew exactly what you were saying. Instead, I pulled rank based on a uniform that has nothing to do with competence. Katherine picked up the whiskey bottle and poured herself a small amount. So why am I here, Dr. Webb? If this is about the contract Whitmore offered me, it's about whether we can work together if you take that contract. Webb met her eyes. I read your service record after Whitmore chewed me out this afternoon. 3 deployments, 15 years, specializing in trauma care under combat conditions. You've seen things I've only read about in textbooks. You've made decisions in situations where there was no time for second opinions or peer reviews. He paused. That scares the hell out of me. Because you think I'll undermine you. Because I think you'll be right when I'm wrong, and my ego will get in the way of listening. He refilled his glass but didn't drink yet. I'm a good doctor, Captain Brennan. I know I am. I trained at one of the best programs in the country. I've published research. I've got a 93% success rate in critical interventions. But I've never worked a battlefield. I've never had to make a call with mortars falling and no backup coming. I've never had to choose which soldier lives because I don't have enough supplies to save them all. His voice dropped. And this morning, in that trauma bay, I realized that all my training didn't prepare me for the kind of instinct you showed. The way you just knew. Katherine sipped the whiskey. It was cheap and harsh, exactly what she expected. You're scared I'll make you look incompetent. I'm scared you'll expose gaps in my knowledge that I didn't know existed. Webb finally drank. But I'm more scared of what happens to my patients if I let my pride stop me from learning from someone who's better at this than I am. That got Katherine's attention. Better? At trauma? At reading a critical situation in real time and making the right call under pressure? Yes. Better. He said it like it physically hurt. I've got the degrees and the research papers. You've got the scars and the experience. If you take this position, I need to know you'll work with me, not around me. I need to know we can function as a team. Katherine considered him carefully. Marcus Webb was proud, defensive, and territorial, everything she'd learned to expect from civilian physicians who'd never worked outside pristine hospital environments. But he was also sitting here, drinking cheap whiskey and admitting his limitations to someone he'd tried to throw out of his ER 8 hours ago. That took guts. If I take the position, she said slowly, here's what I need from you. When I see something critical, I'm going to say it. Directly. No time for diplomatic phrasing or respecting chain of command. If that makes you uncomfortable, you need to get over it fast, because soldiers die when medical professionals waste time being polite. Webb nodded. I can handle direct. And when I'm wrong, because I will be wrong sometimes, you call me on it. Immediately. No deference because of my rank or my service record. We're both professionals. We correct each other. Clear? Clear. Katherine extended her hand across the table. Then we have an understanding, Dr. Webb. He shook it. His grip was strong, steady. Call me Marcus. If we're going to work together, we might as well skip the formalities. Kate, she replied. They sat in silence for a moment, the weight of the agreement settling between them. Then Marcus refilled both their glasses. Can I ask you something? He said. Depends on the question. Why did you stop practicing medicine? Really? Because that story you told Whitmore about not adapting to civilian hospitals? I don't buy it. Someone with your skills doesn't just forget how to be a nurse. Katherine stared into her glass, watching the amber liquid catch the light. I didn't forget. I just got tired of being punished for being good at it. What do you mean? Combat medicine operates on a different code than civilian medicine. When someone's dying in front of you, you do whatever it takes to keep them alive. You don't wait for authorization. You don't check with administration. You don't worry about liability or protocols or whether the insurance company approved the procedure. She looked up at him. And when you bring that mentality into a civilian hospital, people call you reckless, aggressive, insubordinate. They say you don't respect proper channels. But you save lives. Yeah, and then I get fired for saving them the wrong way. Katherine drained her glass. After the third hospital let me go, I realized I had a choice. Keep beating my head against a system that didn't want me, or find work that didn't involve watching people die because someone in administration was more worried about lawsuits than outcomes. Marcus was quiet for a long moment. Whitmore's offering you a way back. Whitmore's offering me a military hospital, which means military culture, which means I'll be right back in the same situations that got me fired from civilian medicine. Except this time you'll have a base commander who specifically wants your combat experience, and a chief of emergency medicine who just admitted he needs you more than his pride. Marcus leaned forward. Look, I'm not going to pretend this will be easy. You're going to step on toes. You're going to make people uncomfortable. But Colonel Whitmore doesn't strike me as someone who cares about comfort. She cares about results. And you? I care about not losing patience because I was too stubborn to listen to someone who knows more than I do. He met her eyes. Take the job, Kate. Come back to medicine. The ER needs you. Hell, I need you, even if saying that out loud makes me want to punch something. Katherine almost smiled. You're really selling this. I'm being honest, which is apparently what we're doing now. He pushed the contract folder, which Katherine hadn't even realized he'd brought, across the table. Sign it. Come back Monday. Show me everything I don't know about keeping soldiers alive. She looked at the folder, then at Marcus, then back at the folder. Then she pulled out a pen and signed her name. What? On Monday morning, Katherine walked through the emergency department doors of Stillwater Veterans Hospital, wearing scrubs instead of a custodian's uniform. The transformation was jarring, not just for her, but for everyone who'd grown accustomed to seeing her push a mop cart. Sarah Lynn spotted her first and actually gasped. Oh my God, you came back! Apparently so, Katherine said. Dr. Webb, Marcus, he told us this morning, we're getting a combat trauma specialist on staff. Sarah's grin was enormous. Half the nurses are terrified, and the other half are excited. I'm both. You should be both. Marcus appeared from one of the exam rooms, coffee in hand, looking like he hadn't slept. Captain Brennan, welcome to organized chaos. Just Kate, and I've worked in plenty of chaos. Yes, but this is bureaucratic chaos, which is worse. He gestured toward the central nursing station. We've got a full board already. 3 motor vehicle accidents from overnight, 2 training injuries that probably should have been treated on base but got sent here anyway, and 1 cardiac patient who keeps trying to leave against medical advice. Katherine surveyed the department with practiced eyes. Organized chaos was right, controlled on the surface, barely holding together underneath. She could work with this. Where do you want me? She asked. Trauma Bay 1. MVA, patient with suspected internal bleeding. Fourth-year resident is in there now, but he's hesitating on whether to call for surgery. Marcus handed her a tablet with the patient's chart. I want you to observe, assess, and give me your honest opinion. Just observe? For now, I need to see how you work before I turn you loose. He paused. And before you argue, remember that this is still my ER, and I'm still responsible for everything that happens in it. We're partners, but I'm the one who signs the final charts. Fair enough. Katherine took the tablet and headed toward Trauma Bay 1. The patient was a 28-year-old civilian contractor, unconscious, multiple contusions visible, vitals stable, but concerning. The resident, his name tag read Dr. Paul Henderson, was reviewing labs on the computer, his face creased with uncertainty. Katherine stood in the doorway and watched. Henderson ordered another round of blood work. Waited for results. Checked the patient's abdomen again. Hesitated. She gave him 3 more minutes before she spoke. You're waiting to see if the bleeding stops on its own. Henderson jumped, startled. Who? Katherine Brennan, new trauma specialist, and you're making a mistake. Excuse me? Look at the progression. Katherine moved to the monitor, pointing at the vitals trending over the past 20 minutes. BP's dropping incrementally, heart rate's climbing to compensate. That's not stabilization. That's a slow bleed that's going to turn into a fast bleed the second his body can't compensate anymore. Henderson's face flushed. I was about to call surgery. You were about to wait for one more lab result to justify a decision you already know you need to make. Katherine kept her voice level. This patient needs a CT scan and surgical consult immediately. Not in 10 minutes. Not after the next blood draw. Now. Dr. Webb said you were supposed to observe. I am observing. I'm observing you waste time that this patient doesn't have. For a moment, she thought Henderson was going to argue. Then Marcus's voice came from behind her. Do what she says, Paul. Henderson looked between them, clearly torn between protocol and pressure. Then he grabbed the phone and called radiology. Katherine turned to find Marcus leaning against the doorframe, arms crossed. Observing and keeping quiet aren't the same thing, he said mildly. You said you wanted my honest assessment. I did. And you were right, again. He didn't sound happy about it, but he didn't sound angry either. Henderson's a good resident, but he second-guesses himself. You just gave him permission to trust his instincts. I gave him a kick in the ass. Same thing, different delivery method. 2 orderlies arrived to transport the patient to CT. As they wheeled him out, Henderson paused next to Katherine. Thank you, he said quietly. I knew something was wrong, but I kept talking myself out of acting on it. That's how people die, Katherine said. Trust your gut. It's usually smarter than your brain. Henderson nodded and followed the patient toward radiology. Marcus waited until they were alone. You're going to terrify half my staff. Probably, and the other half are going to worship you. Also probably. He almost smiled. This is going to be interesting. They worked side by side for the rest of the morning. Katherine observed 3 more cases, intervened in 2 of them, and managed to avoid starting any arguments with residents who didn't appreciate being corrected by someone who'd technically only been on staff for 4 hours. By noon, word had spread through the hospital. The janitor who'd saved Private Fletcher's life was back, and she wasn't mopping floors anymore. And that's when Colonel Whitmore appeared in the ER with a man Katherine didn't recognize. Civilian clothes, expensive suit, the kind of polished appearance that screamed administrator. Kate, Whitmore said, this is Raymond Haskell, hospital director for the Stillwater Veterans Complex. He wanted to meet you personally. Katherine shook the offered hand, already not liking where this was going. Haskell's smile was professional and empty. Captain Brennan, I've heard quite a bit about you since last week's incident. Impressive save. Just doing the job. Yes, well, about that job, I wanted to discuss some concerns that have been brought to my attention regarding your hiring. Marcus appeared at Katherine's elbow. What concerns? Haskell's smile never wavered. This is a complex medical facility with strict protocols and oversight requirements. While I'm sure Captain Brennan's military experience is valuable, we need to ensure that all our staff, especially those in critical care positions, are operating within current civilian medical standards and regulatory frameworks. Translation. You're too aggressive and someone complained. Katherine kept her expression neutral. I'm not sure I understand the concern, Mr. Haskell. simply that we need to maintain consistency in our treatment approaches. I've received reports that you've been, let's say, quite direct in your interactions with our residents and attending physicians." "She's been right in her interactions," Marcus said sharply. "Every assessment she's made today has been accurate. I'm not questioning her accuracy. I'm questioning whether her methods align with our institutional culture." Colonel Whitmore's expression had gone very cold. "Mr. Haskell, I'm not sure if you're aware, but Captain Brennan was hired specifically at my request and reports directly to me. Her employment status isn't subject to administrative review. With respect, Colonel, while this is a military facility, it's still subject to Joint Commission standards and civilian oversight regulations. I have an obligation to ensure that—" He stopped mid-sentence because the trauma alarm had just gone off. "Mass casualty incident," a voice announced over the intercom. "Training exercise explosion at Fort Dalton. Multiple critical injuries inbound. ETA 4 minutes. All available personnel to ER." The corridor erupted into controlled chaos. Nurses ran for supply carts. Residents cleared exam rooms. Marcus grabbed his phone to call in off-duty staff. And Katherine felt something shift inside her, a gear clicking into place that she'd thought was rusted shut. "How many?" she asked Whitmore. "Initial report says 6 critical, maybe more. Explosive device malfunctioned during demolition training. 6 critical, 4 minutes." Katherine turned to Marcus. "You're going to need to triage fast and brutal. Who's your most experienced trauma surgeon on call?" "Dr. Lisa Zhang. She's good, but she's never handled more than 2 critical cases simultaneously." "Then she's about to learn." Katherine was already moving toward the supply room. "Sarah, I need trauma kits, 6 of them. Henderson, clear trauma bays 1 through 4 and set up overflow in the surgical corridor. Marcus, call the blood bank and tell them we need 10 units of O-neg standing by. More if they've got it." "Kate," Marcus started. "This is what I do," she said, meeting his eyes. "This is what I trained for. You want civilian protocols or you want these soldiers to live?" For 1 second, he hesitated. Then he grabbed his radio. "Blood bank, this is Dr. Webb. We need emergency blood supply to the ER immediately. O-negative, 10 units to start." Katherine turned to find Raymond Haskell staring at her with something between shock and apprehension. "Mr. Haskell," she said pleasantly, "you might want to step out of the way. This is about to get messy." The first ambulance screamed into the bay 3.5 minutes later, and Katherine Brennan walked into the chaos like she'd never left the war. The doors exploded inward, and the first gurney crashed through with a soldier strapped down, his uniform shredded and blackened, blood pooling beneath him faster than the paramedics could compress the wounds. Katherine's eyes tracked every detail in the half-second it took them to wheel him past. Arterial spray pattern, gray-tinged skin tone, labored breathing that meant lung involvement, possibly both. "Trauma 1!" she barked, and the team moved. The second gurney followed 10 seconds later. Then the third. Then 2 more simultaneously, paramedics shouting vital signs that were all dropping, all critical, all demanding immediate intervention that the ER wasn't built to handle at this volume. Marcus stood in the center of the chaos, his face locked in concentration as he tried to coordinate 5 different crises at once. "Zhang, take the abdominal trauma in Bay 2. Henderson, I need you on the chest wound in 3. Sarah, get me—" "Marcus," Katherine's voice cut through the noise like a blade. "You're thinking about this wrong." He turned to her, sweat already beading on his forehead. "What?" "You're assigning cases 1 by 1. That's civilian medicine. This is triage." She moved to the central board and grabbed a marker. "We rank them by survivability and resource cost. Who can we definitely save with what we have? Who's probably going to die no matter what we do? Who's stable enough to wait?" A nurse nearby, older, someone Katherine didn't recognize, stiffened. "We don't just let people die. We save the maximum number of lives with finite resources," Katherine interrupted. "That's the job. Marcus, give me the call." For 3 seconds, he stood frozen, and Katherine could see the war happening behind his eyes. Everything his training told him about equal treatment and first come, first served versus the brutal mathematics of mass casualty that he'd only read about in textbooks. Then he nodded once. "Do it." Katherine scanned the incoming patients with the kind of cold assessment that had kept soldiers alive in field hospitals with half the equipment and 1/10 of the time. Bay 1, massive hemorrhage, BP 60/30, unresponsive. Combat gauze to the femoral, type and cross, and get him to surgery in under 5 minutes or he's gone. Bay 2, sucking chest wound, conscious, saturation at 88. Chest tube, oxygen, he can wait 15 minutes. Bay 3, burns and shrapnel, vitals stable, he's last priority. Bay 4, head trauma, GCS of 6, pupils fixed and dilated. She stopped. The room went very quiet. And? Marcus asked. Katherine met his eyes. Comfort care. Focus resources on the ones we can save. The older nurse made a sound of protest. You can't just, I can and I am. Katherine turned to her. What's your name? Gloria Mendez. I've been a nurse here for 12 years. Then you know that in a mass casualty situation, we don't have 12 years, we have minutes. So either help me save the ones we can, or get out of my way. Gloria's face went red, but before she could respond, Colonel Whitmore's voice cut across the ER. Do what she says, now! The team scattered into motion like a kicked anthill. Katherine was already moving toward Bay 1, stripping on gloves as she went. The soldier on the gurney was maybe 20 years old, his face slack with blood loss, his right leg nearly severed at the thigh. The paramedic compressing the wound looked up at her with desperate eyes. I can't get the bleeding to stop. You're not going to. Move. Katherine shouldered him aside and pressed her hands directly into the wound, finding the femoral artery by feel. Sarah, I need a Foley catheter, 14 gauge, and a curved clamp, 30 seconds. We don't use Foleys for arterial control. We do when the alternative is this kid bleeding out on my table. Move. Sarah ran. Katherine maintained pressure, feeling the pulse of blood against her palms, counting seconds in her head. The surgeon, Dr. Zhang, appeared at her shoulder, eyes wide. What do you need from me? Zhang asked. Operating room, 2 units of blood on standby, and a vascular tray because we're probably going to need grafts. Katherine didn't look up. How fast can you work? Fast enough if you can keep him alive until I get there. That's the plan. Sarah returned with the supplies. Katherine released pressure for exactly 2 seconds, threaded the Foley into the artery like she'd done it 1,000 times before, because she had, in tents and bunkers in the backs of transport vehicles, and inflated the balloon to create a makeshift tamponade. The bleeding slowed to a seep. That's impossible, Zhang breathed. It's field medicine. You work with what you have. Katherine checked the monitor. BP climbing. Barely. Get him upstairs. You've got maybe 20 minutes before that Foley fails. Zhang didn't waste time arguing. The team wheeled the soldier toward the elevators at a dead run. Katherine moved to Bay 2. The soldier there was conscious, which was both good and terrible. He was sucking air through a hole in his chest wall, his eyes rolling with panic, trying to speak around the oxygen mask. Easy, Katherine said, positioning herself where he could see her. You've got a pneumothorax. We're going to fix it. Stay with me. Can't breathe. I know. 60 seconds and you'll feel better. She looked at Henderson, who was standing there with a chest tube kit, but clearly hadn't done this before. You ever placed one of these? In simulation, not the same. Watch. Katherine prepped the insertion site, found the landmarks, made the incision, and drove the tube home in one smooth motion that made Henderson flinch. Air hissed out immediately. The soldier gasped, then started breathing easier. See that? Katherine said to Henderson. That's what it sounds like when you do it right. Now secure it and monitor his CTAs. If they drop below 90, page me immediately. You're not staying. I've got 4 more patients. You've got this one. Don't make me regret that call. She moved to Bay 3. Burns and shrapnel. The soldier was conscious, in pain, but stable. Katherine did a rapid assessment. 2nd-degree burns over maybe 15% of his body, superficial shrapnel wounds that looked worse than they were. You're going to be fine, she told him. Hurts like hell, but you'll live. We're going to get you cleaned up and on pain meds, but the critical cases go first. Understood? The soldier nodded through gritted teeth. Do what you gotta do, ma'am. Katherine flagged a nurse. Ringer's lactate, morphine 4 milligrams, and get him to the burn unit when we have space. Monitor for shock, but he's low priority. Then she moved to Bay 4, the head trauma case. The soldier was maybe 25, bleeding from his ears, one pupil blown completely, barely breathing on his own. Katherine checked his vitals, his neuroresponses, the pattern of his injuries. She'd seen this before, too many times. Diffuse axonal injury, massive intracranial pressure. Even if they cracked his skull and evacuated the hematoma, even if they put him on a ventilator and threw every intervention in the book at him, the damage was already done. He wasn't coming back. Marcus appeared at her side. "What do you think?" Katherine pulled him away from the gurney, out of earshot. "I think we make him comfortable and focus on the ones who have a chance." "You're sure?" "I've been sure about this 5 times in my career. It doesn't get easier, but it doesn't change the answer." She looked back at the dying soldier. "He's got maybe an hour. We can waste resources trying to buy him 2 hours, or we can make sure those other 4 walk out of here alive." Marcus's jaw worked. His family will grieve either way, but at least 4 other families won't have to. It was brutal. It was necessary. And it was the kind of decision that civilian doctors weren't trained to make, because civilian medicine operated on the assumption that you could save everyone if you just tried hard enough. Combat medicine knew better. Marcus gave the order. The soldier was moved to a quiet room with a nurse assigned to monitor him, to hold his hand, to make sure he didn't die alone. It was all they could give him. Katherine went back to Bay 1, where Gloria Mendez was staring at her with something between horror and accusation. "You just gave up on him," Gloria said. "I prioritized the others." "That's not how medicine works." "That's exactly how medicine works when you don't have infinite resources and perfect conditions." Katherine stripped off her gloves. "You work in a military hospital. You've never had to make this call before?" "Not like this. Not so cold." Cold keeps people alive. Emotional keeps you second-guessing until everyone's dead. Katherine moved past her. "You want to be angry at me? Fine. Be angry after we've saved the ones we can save." The next 90 minutes were a blur of blood and adrenaline and decisions made in fractions of seconds. The soldier from Bay 1 made it through surgery. The chest wound in Bay 2 stabilized and was moved to ICU. The burn victim got treatment and would recover fully. The head trauma case died at 13:47 hours with a nurse holding his hand. 4 out of 5. In civilian medicine, that was failure. In combat medicine, that was victory. Katherine stood in the scrub room afterward, washing blood off her hands for the 3rd time, watching the pink water spiral down the drain. Her back ached. Her legs were starting to shake from the adrenaline crash. She was 67 years old, and she'd just worked like she was 30 again. The door opened behind her. Marcus came in, looking like he'd aged 5 years in 2 hours. "Zhang says the femoral repair is holding," he said quietly. "She wants to know where you learned that Foley catheter technique." "Mosul, 2008. We ran out of proper vascular clamps and had to improvise." Katherine dried her hands. "It's not in any textbook." "No, it's not." Marcus leaned against the wall. 4 out of 5. "Yeah." "The head trauma case, Private James Delacroix, 24 years old, engaged?" Katherine closed her eyes briefly. "I know. Was there really nothing we could have done? We could have intubated him, sedated him, drilled his skull, and kept his body alive for another 6 hours while his brain died by degrees. Would that have made you feel better?" "No." "Then we did the right thing." Marcus was quiet for a long moment. "That was the hardest 2 hours of my career. It was a Tuesday for me." Katherine looked at him. "Not trying to be callous, just honest. This is what combat medicine looks like. You make impossible choices, and you live with them because the alternative is making no choices and watching everyone die. How do you live with it?" "Badly. But I live." She headed for the door. "I'm going to check on the patients. You should eat something. Next crisis could hit in 20 minutes. She left him there and went back to the ER. The chaos had settled into a controlled aftermath. Nurses were restocking supplies. Residents were updating charts. The normal rhythm of a hospital that had just survived something abnormal. Sarah Lynn caught her in the hallway. "That was incredible, the way you just took control. I've never seen anything like it." "You will again. This won't be the last mass casualty we handle." "I hope I can be that calm when it happens." "You won't be calm. You'll be terrified, but you'll do the job anyway." Katherine paused. "You did good work today. The chest tube patient is stable because you monitored him correctly." Sarah's face lit up. "Thank you. That means—" She stopped. "Colonel Whitmore is looking for you. She's in the administrative office with Mr. Haskell." Of course she was. Katherine found them in a conference room with glass walls that let everyone in the hospital see inside. Whitmore sat at the head of the table, her expression unreadable. Haskell stood by the window, looking like he'd just swallowed something unpleasant. "Captain Brennan," Whitmore said. "Sit." Katherine sat. Haskell turned from the window. "We need to discuss what happened today. We triaged a mass casualty incident and saved 4 out of 5 critical patients. What's to discuss? Your decision to discontinue treatment on Private Delacroix. I've received a complaint from Nurse Mendez regarding your handling of that case." Katherine kept her expression neutral. "Gloria disagreed with the triage decision. She says you gave up on a patient who deserved the same level of care as the others. She's wrong. That's your professional opinion? That's mathematical fact." Katherine leaned forward. "We had 5 critical patients and finite resources. Private Delacroix had diffuse axonal injury with fixed dilated pupils, GCS of 6, and bleeding from both ears. Even with aggressive intervention, his survival probability was less than 5%, and his chance of meaningful recovery was effectively 0. Meanwhile, we had a femoral artery hemorrhage that needed immediate surgical intervention, a tension pneumothorax, and 2 other cases that required active management. If we'd wasted resources on Delacroix, 1 or more of the others would have died. "Topamos amos." Haskell's voice was cold. "We don't practice medicine based on percentages and resource allocation." "Then you practice bad medicine." "Excuse me?" "You heard me. In a mass casualty scenario, if you try to save everyone equally, you save no one. That's not opinion. That's documented medical fact backed by decades of combat and disaster medicine research." Katherine stood up. Private Delacroix was going to die regardless of what we did. The question was whether he'd die alone, or whether he'd die while we watched 3 other soldiers bleed out because we were too squeamish to make the hard call. That's an incredibly callous way to discuss a human life. It's an incredibly honest way. And if you can't handle honesty about life and death, you shouldn't be running a hospital that treats combat injuries. Whitmore finally spoke. "Mr. Haskell, Captain Brennan's triage decisions were consistent with military medical protocols and disaster response standards. Nurse Mendez is welcome to file a formal complaint, but I suspect it won't go anywhere given that we had an 80% survival rate on critical trauma cases that arrived simultaneously. The families will be notified that we did everything medically appropriate, which is true." Whitmore's voice carried an edge. "Or would you prefer I tell Private Delacroix's fiancée that we could have saved 3 other soldiers but chose not to because we were busy performing futile interventions on her husband-to-be?" Haskell's face went red. "Colonel, I don't care what you appreciate. This is a military hospital. Captain Brennan made the correct call. If you have a problem with that, take it up with the Pentagon. Otherwise, I suggest you let my medical staff do their jobs." The temperature in the room dropped about 20 degrees. Haskell stared at Whitmore, clearly weighing whether to push back, then apparently decided against career suicide. "I'll be filing a report," he said stiffly. "You do that." Whitmore dismissed him with a glance. Haskell left, and Katherine found herself alone with the colonel. "He's going to be a problem," Katherine said. "He's always been a problem. I just don't usually have to deal with him directly." Whitmore pulled out a folder. "This is the after-action report from today's incident. I need you to review it and sign off on the triage decisions." Katherine took the folder. "You're covering your ass." "I'm covering yours. Haskell's going to try to use this as ammunition to get you removed. He doesn't like disruption, and you're very disruptive." Whitmore almost smiled. "Which is exactly why I hired you. To disrupt things. To save lives. The disruption is just a bonus." Whitmore stood. "You did exactly what I hoped you'd do today. You took an impossible situation and made it survivable. That's worth more than Haskell's comfort." Katherine opened the folder and scanned the report. It was thorough, technical, and completely supported her decisions. "You wrote this before talking to me." "I wrote it while watching you work. I knew what you'd done and why you'd done it." Whitmore headed for the door. "Sign it, file it, then go home and get some rest. Something tells me we're not done yet." She left Katherine alone in the conference room with a report that would either protect her or bury her, depending on who read it and what they wanted to see. Katherine signed it anyway. The call came at 03:47 hours on Thursday morning. Katherine answered her phone with the instant alertness of someone who'd spent 15 years being woken up for emergencies. Brennan. Kate, it's Marcus. We've got a situation. She was already getting dressed. How bad? Bad enough that Whitmore called me personally. There's been an incident at Fort Dalton, some kind of structural collapse during night training. Multiple casualties incoming, but that's not the problem. What's the problem? One of the casualties is Major General David Thornton. Katherine froze with her shirt halfway on. The base commander? Yeah, and apparently he's critical. ETA 15 minutes. Whitmore wants you there. I'm on my way. She made it to the hospital in 12 minutes, breaking every speed limit between her apartment and Stillwater. The ER was already lit up like a combat zone, staff moving with controlled urgency. Marcus met her at the door. What do we know? She asked. Training building collapsed. Thornton was doing a surprise inspection. Wrong place, wrong time. Reports say he's got crush injuries, possible spinal involvement, and he was unconscious when they pulled him out. Who else is coming in? 3 other soldiers, less critical but still serious. Katherine processed that. So we've got the base commander fighting for his life, which means every decision we make is going to be scrutinized by people who outrank both of us. Pretty much? Great. The ambulance screamed into the bay 9 minutes later. The paramedics wheeled out a stretcher carrying a man in his 50s, unconscious, cervical collar in place, blood visible through makeshift bandages. Behind him came Colonel Whitmore, still in her evening uniform, her face locked in professional concern. Status? Whitmore demanded. The lead paramedic rattled off vitals while they moved toward Trauma 1. BP 90 over 60, heart rate 120, decreased breath sounds on the right side, obvious deformity to the left leg, GCS 7 at scene, upgraded to 9 en route. Katherine was already scanning for injuries. Flail chest, possible hemothorax, compound fracture of the femur, head trauma indicated by the depressed consciousness. This was bad, but it was survivable if they moved fast. Trauma 1, she said. Marcus, I need a chest x-ray stat, type and cross for 6 units, and get ortho on standby. Whitmore, who's his next of kin? His wife is being notified. She's 20 minutes out. Then we've got 20 minutes to stabilize him before she arrives, asking questions we'd better have answers to. They moved Thornton into the bay. Katherine took point, and for the next 18 minutes she ran the code with the kind of precision that came from doing this under mortar fire. Chest tube placed, hemorrhage controlled, fracture stabilized, vitals climbing back toward survivable. At minute 19, Dr. Lisa Jang appeared. OR is ready. What am I looking at? Hemothorax is resolved, but he's going to need that femur fixed and probably a head CT to rule out intracranial bleeding. I've got him stable enough to move. Good work. Jang started giving transfer orders. That's when the doors opened and a woman in her early 50s rushed in, her face pale with terror. Where is he? Where's David? Whitmore intercepted her gently. Mrs. Thornton, he's stable. They're preparing to take him to surgery. I want to see him. Now. Katherine stepped back, letting Jang handle the transfer while she gave the wife space to process. But Mrs. Thornton's eyes locked onto Katherine with laser focus. You're the one who saved him, she said. I'm part of the team. Colonel Whitmore told me on the phone, the combat nurse, the one who knows how to handle this. Mrs. Thornton grabbed Katherine's hand with desperate strength. Is he going to be okay? Katherine could have given her the standard line about doing everything possible, about waiting for surgical results, about taking it one step at a time. Instead, she looked the woman in the eyes and gave her the truth. He's got a fighting chance. The next 12 hours are critical, but he's strong, and we caught the injuries early. But he'll live? I think so. Yes. Mrs. Thornton's grip tightened for a moment, then released. Thank you. They wheeled Thornton towards surgery, his wife following behind, and Katherine stood in the sudden quiet of the trauma bay, feeling the adrenaline start to ebb. Marcus appeared at her shoulder. You told her he'd live. I told her I think he'll live. There's a difference. Not to her there isn't. If he dies, then I was wrong. But giving her false hope is better than giving her no hope. That's not how we usually... I know how you usually do it. I'm not you. Marcus looked like he wanted to argue, but then Sarah Lynn's voice cut across the ER, sharp with alarm. We've got a problem. Katherine and Marcus both turned. Sarah stood in the doorway of Bay 3, where one of the other soldiers from the collapse had been sent for observation. Her face was white. His abdomen's rigid and distending. I think he's bleeding internally. Katherine was already moving. She reached the bay in 6 strides and immediately saw the problem. The soldier, young, maybe 22, had been stable when they'd brought him in. Superficial injuries, good vitals, tagged as non-critical. Now his belly was hard as a drum and growing visibly larger. "He wasn't like this 10 minutes ago," Sarah said, her voice climbing toward panic. Katherine pressed her hands to the soldier's abdomen and felt the unmistakable tension of free fluid. Blood pooling faster than his body could compensate. "How long since his last vitals check?" 15 minutes. We were focused on the general, "Get me an ultrasound, now." Katherine grabbed her stethoscope, listening for bowel sounds that weren't there. Classic acute abdomen. Something had ruptured internally, probably delayed by the initial adrenaline surge, and now he was bleeding out where they couldn't see it. The portable ultrasound arrived. Katherine scanned his abdomen and saw exactly what she'd feared, free fluid everywhere, liters of it. "He needs surgery immediately," she said. "Where's Zhang?" "Still in the OR with General Thornton," Marcus said, appearing behind her. "ETA 90 minutes minimum." "He doesn't have 90 minutes. He's got maybe 20 before he crashes completely. There's no other trauma surgeon available. Then we stabilize him and prep for transport to another facility." But even as she said it, Katherine knew they didn't have time. The nearest trauma center with surgical capacity was 40 minutes away. This soldier would be dead before they got him loaded. She looked at the monitor. BP already dropping, heart rate climbing, early signs of shock that would become irreversible shock in minutes. "Kate," Marcus said quietly, and she could hear the question he wasn't asking. Could she do it? Could she crack this kid open, find the bleeder, and fix it without a surgeon, without an OR, with nothing but field experience and desperation? She'd done it before, in tents and bunkers and places where the choice was try or watch them die. But that was war. This was a hospital. There were rules, protocols, liability. "Call the nearest trauma center," she said. "Get them ready for a transfer." "Kate, do it." Marcus pulled out his phone, and Katherine watched the soldier's blood pressure continue to fall, knowing she'd just made a decision that would haunt her either way. The soldier's blood pressure hit 70/40, and Katherine's hands were moving before her brain finished the decision. She grabbed Sarah's arm hard enough to leave marks. "Get me a crash cart, 2 units of O-neg, and a laparotomy kit. 60 seconds. Sarah's eyes went wide. "We can't do surgery here." 55 seconds. Sarah ran. Marcus ended his phone call and turned back to find Katherine already stripping off her jacket, rolling up her sleeves. "What are you doing? What needs to be done?" "Kate, this is insane. We don't have surgical capability in the ER. We've got scalpels, clamps, and sutures. That's all I need." She was pulling on sterile gloves now, moving with the mechanical efficiency of someone who'd done this in worse conditions. "The transfer will take 40 minutes. He's got maybe 10 before he's too far gone to save. Do the math. This isn't a field hospital in Iraq." "No, it's worse. In Iraq, I didn't have administrators breathing down my neck." Katherine looked at him directly. "You want to help, or you want to watch him die while we follow protocol?" Marcus's face went through about 6 different expressions in 3 seconds. Then he started pulling on gloves. "What do you need?" "Anesthesia, local only, we don't have time for general, and hold the ultrasound wand steady so I can see where I'm cutting." Sarah crashed back through the doors with the supplies on a cart. Behind her came Henderson, looking terrified but determined. "I heard what's happening," Henderson said. "I want to help." "Can you maintain an airway if this goes sideways?" Katherine asked. "Yes." "Then get ready." She positioned the ultrasound wand over the soldier's abdomen, mapping the fluid, finding the most likely source. Splenic rupture, maybe liver involvement, the kind of injury that killed people slowly until suddenly it killed them fast. "Someone needs to call Colonel Whitmore," Marcus said. "After," Katherine replied. "She can yell at me when he's alive." She didn't wait for permission. The scalpel moved in one clean line from sternum to pubis, cutting through skin and fat and muscle layers with practiced precision. Blood welled up immediately, but not the arterial spray she'd feared. She was in the right place. "Suction," she said, and Sarah had it ready before the word finished leaving her mouth. Katherine spread the incision with retractors that Marcus held steady. exposing the peritoneal cavity. Blood everywhere, dark and pooling, but she'd seen worse. She'd worked in worse. Her hands moved through the abdominal cavity with the confidence of muscle memory that never forgot. Left upper quadrant. There. The spleen, ruptured along the lower pole, bleeding steadily into the abdomen. She could feel the edges of the laceration, could assess the damage by touch alone. "Clamp," she said. Marcus handed it over. Katherine isolated the splenic artery, clamped it, and the bleeding slowed to a manageable ooze. The soldier's blood pressure ticked up slightly. Not much, but enough. "He needs the spleen out," she said. "Can't repair this much damage." "You're going to do a splenectomy in the ER," Henderson's voice cracked. "I'm going to do a splenectomy or he's going to die. Pick one." She didn't wait for an answer. Her hands moved through the steps she'd done dozens of times in surgical tents, with explosions shaking the walls. Divide the ligaments, free the spleen, tie off the vessels, extract the organ. Textbook procedure executed in conditions that would make textbook authors faint. 15 minutes later, she was holding a ruptured spleen in her hand, placing it in a specimen container that Sarah held ready. "Check for other injuries," Marcus said, because he'd apparently decided that if they were doing this, they were doing it right. Katherine packed the abdomen with gauze and did a systematic sweep. Liver intact, kidneys intact. No other obvious sources of bleeding. She removed the packs, flushed the cavity with saline, and started closing layers. The soldier's blood pressure was climbing. 90 over 50, 100 over 60, color returning to his face. She was tying off the final suture when the doors burst open and Colonel Whitmore strode in, followed by Raymond Haskell, who looked like he'd just witnessed a murder. "What the hell is going on here?" Haskell demanded. Katherine didn't look up from her work. "Emergency splenectomy. Patient had a delayed rupture from the building collapse. He was bleeding out internally." "You performed surgery in the emergency department?" "I performed a procedure necessary to save his life in the location where he was dying." "That's completely outside. Mr. Haskell." Whitmore's voice could have frozen nitrogen. "Shut up." Haskell's mouth snapped closed. Whitmore moved to the bedside, looking down at the soldier, then at Katherine. "Status?" "EC. Stable. Spleen's out, no other injuries found. He'll need ICU monitoring, but he should recover fully." Katherine tied off the last suture. "He would have been dead in another 8 minutes." "And you made this decision without consulting anyone?" "I made it without wasting time that we didn't have." Whitmore was silent for a long moment. Then she turned to Haskell. "Get out." "Colonel, I have every right. You have the right to leave this room before I have you removed from this hospital entirely. Your choice." Haskell left, and the temperature in the room dropped back toward normal. Whitmore waited until the doors closed behind him. "That was reckless. That was necessary. Those aren't mutually exclusive." Whitmore looked at Marcus. "Dr. Webb, your assessment?" Marcus stripped off his gloves carefully. Captain Brennan identified a life-threatening condition that required immediate intervention. Transfer time would have resulted in patient death. The procedure was executed competently with available resources. I supported the decision. "You supported an unauthorized surgery in an emergency department." "I supported saving a soldier's life when the alternative was watching him die." Marcus met Whitmore's eyes. "If you're going to discipline someone, discipline both of us." The soldier on the gurney stirred, his eyes flickering open. "What happened?" Katherine leaned into his field of vision. "You had some internal bleeding. We fixed it. You're going to be fine." Did we get everyone out? The building? Everyone's accounted for. Rest now." His eyes closed again, sliding back into medicated sleep. Whitmore gestured toward the door. "Conference room. Now. Both of you." They followed her to the same glass-walled room where Katherine had been questioned after the mass casualty incident. This time, Whitmore didn't sit. She paced. "I hired you because I wanted someone who could make hard decisions under pressure," she said to Katherine. "Not someone who would turn my ER into a battlefield hospital. Every ER is a battlefield hospital when the casualties come in faster than you can handle them." "That's not—" Whitmore stopped herself, took a breath. "Do you have any idea what kind of liability exposure you just created? What Haskell is going to do with this?" I know that soldier is alive, and that's the only thing that matters. To you, maybe. To the Pentagon lawyers who are going to review this incident, it matters that you performed unauthorized surgery outside of an operating room without proper oversight or documentation. Marcus spoke up. I documented everything in real time. The procedure is defensible. Defensible isn't the same as authorized. Whitmore finally stopped pacing and looked at Katherine. You're brilliant, you're experienced, and you're going to get yourself fired if you keep operating like you're still in a combat zone. Then fire me. The words hung in the air like a challenge. Whitmore's expression went carefully neutral. Is that what you want? I want to save lives without having to check with 3 administrators and a lawyer every time someone's dying in front of me. If that's not compatible with this job, then yes, fire me. Katherine stood up. But before you do, go ask that soldier's family if they care about liability exposure or proper documentation. Ask them if they'd rather have their son alive or have perfect paperwork explaining why he died while we waited for authorization. That's not fair. Nothing about this is fair. War isn't fair. Death isn't fair. Medicine isn't fair. Katherine moved toward the door. I spent 15 years keeping soldiers alive in conditions you can't imagine. I'm not going to watch them die here because the conditions are too comfortable. She left the conference room and walked straight into Raymond Haskell, who'd apparently been waiting in the hallway. Captain Brennan, he said with a smile that made her skin crawl. I need you to come with me. There are some people who want to speak with you. What people? Legal department. They have questions about the unauthorized surgical procedure you just performed. Of course they did. Katherine followed Haskell to an office on the administrative floor where 2 people in suits waited. A man in his 40s with the look of someone who'd spent too much time reading regulations, and a woman in her 30s who was already typing on a laptop before Katherine sat down. Captain Brennan, the man said. I'm Thomas Kerrigan, legal counsel for the Stillwater Veterans Hospital complex. This is Ann Forsyth, risk management. We need to ask you some questions about the events that occurred approximately 1 hour ago in Emergency Department Trauma Bay 3. Katherine sat. Ask, did you perform a surgical procedure on a patient in the emergency department? I performed an emergency splenectomy on a patient who was bleeding to death from internal injuries. Were you authorized to perform this procedure? I was authorized by the fact that he was dying. Kerrigan's expression didn't change. That's not how authorization works in a civilian medical facility. Were you granted surgical privileges by the hospital credentialing committee? I was hired 3 days ago. I haven't been through the credentialing process yet. Then you had no authority to perform surgery. I had the authority of being the only person in that room who could keep him alive. Ann Forsyth looked up from her laptop. Captain Brennan, we're trying to determine the hospital's liability exposure from this incident. Your cooperation would be appreciated. My cooperation in what? In explaining why I saved a life? In explaining why you violated hospital protocols and potentially exposed the institution to significant legal risk. Katherine leaned back in her chair. Let me save you some time. I violated your protocols because your protocols are designed for normal situations, and this wasn't normal. I exposed the hospital to legal risk because the alternative was letting a 22-year-old soldier die while we waited for proper authorization. If that creates liability problems for you, I suggest you find better protocols. Kerrigan's jaw tightened. Your attitude isn't helping your case. I don't have a case. I have a saved life. You have paperwork concerns. Those paperwork concerns could result in your termination. The door opened and Colonel Whitmore walked in with a folder in her hand and an expression that could cut steel. This interview is over, she said. Kerrigan stood. Colonel, we have a right to investigate. You have a right to submit your questions in writing through proper channels. You do not have the right to interrogate my staff without my presence or consent. Whitmore dropped the folder on the table. That's the complete documentation of today's incident, prepared by Dr. Marcus Webb and reviewed by me. It demonstrates that Captain Brennan acted within the scope of emergency medical care provisions outlined in military medical regulations, specifically Section 412 regarding life-saving interventions in extremist conditions. This is a civilian hospital subject to Joint Commission standards. This is a military hospital on a military base under my command. Joint Commission accreditation is voluntary, not mandatory. And if you'd like to argue that point, I have the Pentagon Chief of Medical Operations on speed dial. The room went very quiet. Forsyth closed her laptop. Kerrigan's face had gone red. "We'll be filing a formal report," he said stiffly. "You do that. Make sure to include the part where Captain Brennan's actions resulted in a 100% survival rate." Whitmore gestured toward the door. "We're done here." They left, and Katherine found herself alone with Whitmore again. "Thank you," Katherine said quietly. "Don't thank me. You're still in trouble." Whitmore sat down in the chair Kerrigan had vacated. "I just bought you time, not absolution. Haskell is going to push this up the chain. He wants you gone, and now he's got ammunition. So what happens now? Now we wait to see if the soldier you saved wakes up and tells everyone you're a hero, or if the bureaucracy decides that following rules matters more than results." Whitmore rubbed her eyes. "I knew hiring you would cause problems. I just didn't think it would happen this fast. Sorry to disappoint." "You didn't disappoint. You did exactly what I hired you to do. The problem is that what I hired you to do conflicts with what people like Haskell think a hospital should be." Whitmore stood up. "Go home. Get some sleep. And for the next 48 hours, try not to save any more lives in unauthorized ways." Katherine left the hospital as the sun was coming up, her scrub still stained with blood from the surgery, her hands shaking slightly from the adrenaline crash. She sat in her car for 10 minutes before starting the engine, staring at the hospital entrance and wondering if she'd just thrown away the best job offer she'd had in 14 years. Her phone buzzed. Text from Sarah Lynn. "The soldier you saved is named Private Tyler Voss. He's stable in ICU. His mom is here. She wants to meet you." Katherine closed her eyes. She should go home. She should stay away from the hospital until this whole thing blew over. She should absolutely not go talk to the family of someone whose life she'd saved through questionable medical judgment. She got out of the car and went back inside. Tyler Voss's mother was in her late 40s, sitting in the ICU waiting room with red eyes and coffee that had gone cold an hour ago. She looked up when Katherine approached and immediately stood. "Are you Captain Brennan?" "Yes, ma'am. They told me what you did. How you—" Her voice broke. "How you saved my son when they said there wasn't time." Katherine had no idea what to say to that. "I'm glad he's going to be okay. The nurses said you did surgery right there in the emergency room, that you didn't wait, that you just did it." Mrs. Voss grabbed Katherine's hands. "Everyone keeps talking about protocols and procedures and liability, but I don't care about any of that. I care that my son is alive because you were there, because you didn't wait." "Mrs. Voss, no, please, let me finish." The woman's grip tightened. "Tyler is my only child. His father died when he was 10. He's all I have. And if you hadn't been there—" She couldn't finish the sentence. Katherine squeezed back. "He's strong. He's going to recover. Because of you." They stood like that for a moment, two women connected by blood and crisis and the terrible mathematics of life and death. Then Mrs. Voss released her hands and wiped her eyes. "I heard there are people trying to get you in trouble for what you did. It's complicated." "It's not complicated. You saved my son's life. That's all that matters." Mrs. Voss's expression hardened. "If anyone tries to punish you for that, they'll have to go through me first." Katherine managed a tired smile. "Thank you, but this isn't your fight." "Yes, it is. Tyler's in the Army because he believes in protecting people. You protected him. That makes it my fight too." Sarah Lynn appeared in the doorway. "Kate, you need to see this." Katherine followed her to the nursing station where a television was playing the local morning news. The anchor was mid-sentence. "Emergency surgery performed in unconventional circumstances at Stillwater Veterans Hospital has sparked debate about medical protocols and military oversight. The patient, identified as 22-year-old Private Tyler Voss, is reported to be in stable condition following the controversial procedure performed by former Army combat nurse Katherine Brennan. Someone had leaked the story." "Oh, hell," Sarah breathed. The report continued with footage of the hospital exterior, interviews with unidentified sources who questioned the appropriateness of performing surgery outside an operating room, and speculation about potential disciplinary action. Katherine's phone started ringing. Unknown number. She let it go to voicemail. It rang again immediately. Different number, then again. "Reporters," Sarah said. They're going to want statements. They're not getting any from me." But as Katherine turned away from the television, she saw Raymond Haskell at the end of the hallway, talking to a woman with a camera crew. He was smiling, gesturing, giving them exactly the kind of statements that would make the situation exponentially worse. Her phone buzzed again. This time it was Colonel Whitmore. My office. Now. Katherine walked through the hospital feeling every pair of eyes on her. The whispers followed her like a wake. By the time she reached Whitmore's office, she'd counted at least 6 people filming her on their phones. Whitmore was on a call when Katherine entered. She held up one finger, finished the conversation with clipped efficiency, then hung up and turned to Katherine with an expression that gave nothing away. That was the Pentagon Chief of Medical Operations, Whitmore said. He's seen the news. He has questions. I'm sure he does. He wants a formal investigation into the incident, full review of your credentials, your decisions, and the hospital's oversight protocols. Whitmore pulled out another folder. There were always more folders. He's sending a team to conduct interviews starting tomorrow morning. So I'm suspended. No, you're restricted to administrative duties pending the investigation. No patient contact, no clinical decisions. You'll report to Dr. Webb for scheduling and documentation review. Katherine felt something cold settle in her chest. They're trying to bury me. They're trying to determine if you're a liability or an asset. There's a difference. Whitmore opened the folder. The investigation will take approximately 2 weeks. During that time, every decision you've made since starting here will be examined. Every patient outcome, every interaction with staff, everything. And if they decide I'm a liability, then you're out, and probably blacklisted from military medical positions for the foreseeable future. Katherine looked out the window at the hospital campus below. Soldiers walking between buildings, ambulances in the bay, the constant flow of people who needed help that she was now forbidden from giving. I did the right thing, she said quietly. I know, but sometimes doing the right thing isn't enough. Whitmore closed the folder. Tyler Voss is alive because you ignored protocols, but James Delacroix is dead because you chose to let him die. The investigation is going to examine both of those decisions and decide which one defines who you are as a medical professional. Delacroix was going to die anyway. I know that, you know that, but grieving families and Pentagon investigators don't always see it that way. Katherine turned from the window. Is there anything I can do? Pray that Tyler Voss recovers fully and publicly. Pray that no complications develop. And pray that the investigation team actually reads the medical documentation instead of just listening to Raymond Haskell's version of events. I don't pray. Then hope, or whatever it is you do. Whitmore stood up, signaling the meeting was over. You're a brilliant trauma nurse, Kate. But brilliant doesn't matter if you're too controversial to employ. Remember that. Katherine left the office and found Marcus waiting in the hallway. I heard, he said, administrative duties. Apparently saving lives is now a desk job. Kate, don't. Just don't. She was too tired for reassurance or platitudes. I need to go home before I say something that makes this worse. She made it to the parking lot before the exhaustion hit her like a physical force. She sat in her car with her forehead against the steering wheel and tried to remember why she'd signed that contract in the first place. Tried to remember what it felt like to believe she could come back to medicine without everything falling apart. Her phone rang one more time. She almost ignored it, but the number looked familiar. Brennan, she answered. Captain Brennan, this is Ann Forsyth from Risk Management. I'm calling to inform you that Private James Delacroix's fiancée has filed a formal complaint alleging medical negligence in the handling of his case during the mass casualty incident last Tuesday. The complaint specifically names you as having made decisions that contributed to his death. The investigation team will be reviewing this as part of their assessment. Katherine closed her eyes. I understand, she said. You'll be notified when they want to conduct your interview. Until then, no public statements about any patient cases. The line went dead. Katherine sat in silence, watching hospital staff come and go, watching ambulances arrive with new emergencies she wasn't allowed to touch. She'd been back in medicine for less than a week, and she was already being investigated for doing her job too well and not well enough simultaneously. She started the engine and drove home, and when she got there, she found a man in a military uniform standing at her apartment door with an envelope in his hand. Captain Katherine Brennan? He asked. Yes. He handed her the envelope. You've been summoned to appear before a medical review board at Fort Dalton headquarters. Thursday, 0900 hours. Attendance is mandatory. He left before she could ask any questions. Katherine opened the envelope and read the summons. Formal language, official seals, a list of charges that included unauthorized medical procedures, deviation from established protocols, and potential violation of military medical ethics standards. At the bottom, in smaller print, failure to appear will result in immediate termination and potential criminal prosecution. She went inside, closed the door, and finally allowed herself to feel the full weight of what was happening. They weren't just investigating her, they were building a case to destroy her. Katherine didn't sleep that night. She sat at her kitchen table with the summons spread in front of her, reading the charges over and over until the words stopped making sense. By the time dawn broke, she'd drunk an entire pot of coffee and made a decision that probably qualified as either brilliant or suicidal. She wasn't going to the review board alone. At 7:30 hours, she walked into the hospital and found Marcus in the physician's lounge, looking like he'd slept about as well as she had. "I need copies of every patient chart from the last week," she said without preamble. "Complete documentation, times, vitals, interventions, outcomes, everything." Marcus looked up from his coffee. "Kate, you're restricted to administrative duties. I'm preparing for a review board that's trying to end my career. Help me or don't, but I need those charts." He studied her for a moment, then stood up. "Follow me." They went to the records department where Marcus used his credentials to pull electronic files that Katherine wasn't technically authorized to access anymore. Tyler Voss, James Delacroix, Private Devin Fletcher, the mass casualty cases, every patient she'd touched since signing that contract. "What are you looking for?" Marcus asked as she scanned through the data. "Proof that I made the right calls, timestamps that show decision windows, outcome data that demonstrates survival rates." Katherine pulled up Fletcher's chart. "When I saved Fletcher on my first day, how long between his arrest and my intervention?" Marcus checked the timestamps. 47 seconds. "And how long had the code been running before I walked in?" 3 minutes, 12 seconds. So they'd been running the code wrong for over 3 minutes before I corrected it. Katherine made notes. "What's the standard survival rate for a code that's already been running incorrectly for that long?" "Maybe 20%, 30% if you're lucky." Fletcher survived. That's a 100% success rate on a case that had an 80% chance of death. She moved to the next chart. The mass casualty incident, 5 critical patients. Standard triage protocols would have attempted equal treatment across all 5. What's the expected survival rate for that scenario given our resource constraints? Marcus pulled up comparative data from other mass casualty events. 40 to 60%. Maybe 3 out of 5 survive. We got 4 out of 5. Because you triaged Delacroix as comfort care. Exactly. And that decision is going to be the centerpiece of the complaint against me. Katherine looked at him. "I need to prove that Delacroix was unsalvageable before I made that call. Can you help me build that case?" Marcus hesitated, and she could see the calculation happening behind his eyes. Helping her meant putting his own neck on the line. Supporting her decisions meant owning them as much as she did. "Yeah," he said finally. "I can help." They spent the next 2 hours building a medical case file that would either vindicate Katherine or prove insufficient against the bureaucratic machinery trying to grind her down. By the time they finished, Sarah Lynn had found them. "You need to see this," she said, holding up her phone. The video was everywhere. Social media, news sites, even medical forums. Tyler Voss's mother had given an interview to a local news station, and it had gone viral. She sat in front of the camera, with tears streaming down her face, talking about how Katherine had saved her son's life when everyone else had said there wasn't time. How she'd performed emergency surgery in an ER because moving him would have meant death. How bureaucrats were now trying to punish her for refusing to let a soldier die. "That woman is a hero," Mrs. Voss said directly into the camera. "And if this hospital tries to fire her for saving my son, I will make sure everyone knows exactly what kind of institution puts paperwork over people's lives." The interview had been viewed over 2 million times in 6 hours. "Oh, hell," Marcus breathed. Katherine's phone started ringing immediately. She recognized Colonel Whitmore's number. "I'm watching the news," Whitmore said without greeting. "Please tell me you didn't orchestrate this." "I didn't even know she was giving an interview." "Well, she did. And now the Pentagon is receiving calls from congressional offices asking why a decorated combat nurse is being investigated for saving lives." Whitmore's voice carried a mix of frustration and something that might have been satisfaction. The review board has been moved up to tomorrow morning, 800 hours. They want this resolved before it becomes a bigger circus than it already is. Understood. And Kate, bring everything you've got. This is going to be a fight. The call ended and Katherine looked at Marcus. I've got less than 24 hours. Then we'd better keep working. But before they could move, Raymond Haskell appeared in the doorway with 2 security guards flanking him. Captain Brennan, he said with a smile that didn't reach his eyes, I need you to come with me. Colonel Whitmore's orders. Katherine exchanged a glance with Marcus, then followed Haskell to the administrative wing. But instead of going to Whitmore's office, he led her to a conference room where Ann Forsyth and Thomas Kerrigan waited with stacks of documentation that looked ominous. Where's Colonel Whitmore? Katherine asked. Detained with other matters, Haskell said smoothly. We're conducting a preliminary interview regarding the Delacroix complaint. I was told the investigation wouldn't begin until the review board. This is separate. The family's complaint requires immediate attention. Kerrigan opened a folder. Please sit down, Captain Brennan. Katherine remained standing. I want Colonel Whitmore present. That's not necessary for a preliminary interview. Then this interview doesn't happen. Haskell's smile tightened. You're refusing to cooperate with an official investigation? I'm exercising my right to have my commanding officer present during questioning that could affect my employment status. Katherine pulled out her phone. Would you like me to call her, or would you? For a moment, Haskell looked like he wanted to argue. Then Forsyth cleared her throat. Perhaps we should reschedule, she said carefully. Once Colonel Whitmore is available. Katherine left the conference room and nearly collided with Dr. Lisa Jang in the hallway. I've been looking for you, Jang said. I need to talk to you about something that happened during General Thornton's surgery. They found an empty office, and Jang closed the door behind them. What is it? Katherine asked. The general's doing well, better than expected, actually. But while I was operating, I found something that bothers me. Jang pulled up images on her tablet. Look at this incision pattern on his femur. The break itself is consistent with crush injury, but there's evidence of pre-existing stress fractures that had been developing for weeks, maybe months. Katherine examined the images. You think the collapse didn't cause the injury? I think the collapse exacerbated an existing condition that should have been caught during routine medical screenings. Jang swiped to another image. And this is where it gets interesting. I pulled his medical records from the last 6 months. He had 3 separate visits to base medical complaining of leg pain. Each time he was told it was probably just overexertion and sent home with ibuprofen. Who treated him? Different physicians each time. But all 3 visits were processed through the same administrative approval system. Jang met Katherine's eyes. Guess who oversees medical screening protocols for senior officers at Fort Dalton? Haskell. Haskell. And according to the documentation, he personally signed off on the decision to defer advanced imaging for cost containment reasons. Katherine felt something click into place. He cut corners on the base commander's medical care to save money. And now the base commander nearly died because of it. If the building collapse hadn't happened, that stress fracture would have progressed to a complete break during some routine activity. Could have happened while he was driving, or on a staircase, or anywhere that a sudden fracture would have been catastrophic. Does Whitmore know? Not yet. I wanted to talk to you first because... Jang hesitated. Because Haskell's been pushing hard to get you fired, and this gives you leverage. Katherine looked at the images again, her mind already calculating angles. This information needs to go to Whitmore immediately. Are you going to use it? I'm going to make sure the truth comes out. What happens after that isn't up to me. They found Colonel Whitmore in her office, and Jang presented the findings with clinical precision. Whitmore's expression went from interested to concerned to absolutely furious in the space of 3 minutes. He deferred imaging on a general officer to save money? Whitmore's voice was dangerously quiet. 3 times, Jang confirmed. And the documentation shows he overruled physician recommendations each time. Whitmore stood up and walked to her window, staring out at the hospital complex. This is bigger than Captain Brennan's review board. Yes, ma'am, Katherine said. This is the kind of thing that ends careers. Whitmore turned back to them. And if Haskell knows you know about this, he's going to come at you even harder to discredit you before the information goes public. So what do? We document everything. We secure the evidence, and we present it to the review board tomorrow as context for the administrative environment you've been working in. Whitmore's eyes were hard. And then we watch him try to explain why he's more concerned about a nurse who saved lives than an administrator who nearly killed a general through negligence. The rest of the day passed in a blur of preparation. Katherine reviewed charts, compiled timeline data, and built a defense that was part medical argument and part exposure of systemic dysfunction. Marcus helped, as did Sarah Lynn and Henderson, and even Gloria Mendez, who appeared in Katherine's makeshift office around 1600 hours with an apology and an offer to testify if needed. "I was wrong about the triage decision," Gloria said quietly. "I went back and looked at Delacroix's records. I spoke with the trauma surgeons. You were right. He wasn't savable." "You don't have to testify." "Yes, I do. Because I filed the initial complaint that gave his fiancée ammunition to come after you. I need to fix that." Gloria met her eyes. "I've been a nurse for 12 years, and I've never had to make the kind of calls you make. I judged you for it without understanding what you were dealing with. That was wrong." Katherine accepted the apology with a nod, and Gloria left. By 2100 hours, Katherine had a case file that was either bulletproof or completely insufficient, depending on who was reading it. She went home, tried to sleep, failed, and gave up around 0300 hours. She made more coffee, reviewed her notes one more time, and watched the sunrise through her apartment window. At 0700 hours, her phone rang. Unknown number. "Brennan?" she answered. "Captain Brennan, this is Lieutenant General Patricia Moss from Pentagon Medical Operations. I'm calling to inform you that I will be personally overseeing your review board this morning." Katherine's stomach dropped. A lieutenant general. This had just escalated beyond anything she'd anticipated. "Yes, ma'am. I've reviewed the preliminary documentation. I've also reviewed the media coverage, the complaint from Private Delacroix's fiancée, and the statement from Private Voss's mother." Moss's voice was crisp, professional, unreadable. "This review will determine whether you continue in military medical service in any capacity. I expect complete honesty and thorough documentation. Understood?" "Understood." 800 hours. "Don't be late." The line went dead. Katherine arrived at Fort Dalton headquarters at 0745 hours, wearing her most formal civilian clothes and carrying a briefcase full of evidence. Colonel Whitmore met her in the lobby. "Moss is here," Whitmore said quietly. "She brought 2 other generals and the Army Surgeon General's Chief of Staff. This is bigger than I thought." "What does that mean for me?" "It means they're either going to clear you completely or make an example of you. No middle ground." Whitmore walked with her toward the conference room. "Whatever happens in there, remember that you saved lives. That's what matters." The review board was assembled in a room that felt more like a courtroom than a medical conference. Lieutenant General Moss sat in the center, flanked by 2 other generals whose nameplates Katherine didn't have time to read. The Army Surgeon General's Chief of Staff sat to one side with a laptop. Raymond Haskell sat on the other side with his own documentation and a smile that made Katherine want to punch him. "Captain Brennan," General Moss said, "please be seated." Katherine sat. Whitmore took a chair behind her. Moss opened a folder. "This review board has been convened to examine allegations of medical negligence, protocol violations, and unauthorized medical procedures performed by Captain Katherine Brennan during her employment at Stillwater Veterans Hospital. We will hear testimony, review evidence, and make a determination regarding her continued fitness for duty in military medical facilities." She looked at Katherine directly. "Do you understand the proceedings?" "Yes, ma'am. Mr. Haskell has submitted documentation alleging multiple serious violations. We'll begin with his presentation." Haskell stood up with the confidence of someone who thought he'd already won. He laid out his case methodically. Katherine's decision to provide comfort care to Delacroix instead of attempting aggressive intervention, her unauthorized surgery on Tyler Voss, her aggressive correction of physicians in the ER, her disregard for chain of command and established protocols. He made it sound damning. He made it sound like Katherine was a reckless cowboy operating without oversight or concern for patient safety. "The pattern is clear," Haskell concluded. "Captain Brennan operates as though military medicine is still being practiced in field tents rather than modern hospitals with proper standards and accountability. Her actions, while perhaps well-intentioned, represent an unacceptable risk to patient safety and institutional integrity." General Moss made notes. "Captain Brennan, you'll have an opportunity to respond. But first, I'd like to hear from Dr. Marcus Webb, who I understand worked directly with Captain Brennan on several of the cases in question. Marcus entered and was sworn in. He laid out the medical facts with the same precision he used in chart documentation. Fletcher's code and the incorrect protocol that was being used, the mass casualty triage, and the mathematical impossibility of saving all 5 patients, Tyler Voss's internal bleeding, and the time constraints that made ER surgery the only viable option. In each case, Marcus said, Captain Brennan made decisions that prioritized patient survival over administrative comfort. And in each case, the outcome was better than standard protocols would have predicted. But she violated established procedures, one of the other generals interjected. She violated procedures that weren't designed for the situation she encountered. There's a difference between breaking rules recklessly and adapting protocols to save lives. Dr. Webb, Haskell interrupted, isn't it true that you initially tried to remove Captain Brennan from the ER when she first intervened with Private Fletcher? Marcus didn't flinch. Yes, because I didn't know who she was or what her qualifications were. Once I understood her background, I supported her intervention. So you admit your initial instinct was that she was overstepping. My initial instinct was wrong. I've admitted that. I learned from it. Marcus looked at the board. Captain Brennan has been practicing medicine longer than I've been alive. She's seen combat trauma I've only read about. When she tells me something is wrong, I listen now, because she's been right every single time. Haskell's smile had started to slip. The board called Dr. Lisa Zhang next. She presented the findings about General Thornton's pre-existing stress fractures and the deferred imaging that had nearly resulted in catastrophic injury. And then she dropped the bomb. According to hospital records, Mr. Haskell personally overruled physician recommendations for advanced imaging on 3 separate occasions, citing cost containment measures. Had the general's condition been properly diagnosed during any of those visits, the injury during the building collapse would likely have been prevented or significantly mitigated. The room went very quiet. Very ch-eat. General Moss looked at Haskell. Mr. Haskell, did you deny medical imaging to a general officer for budgetary reasons? Haskell had gone pale. The imaging wasn't medically necessary based on the initial assessment. You're not a physician. You're an administrator. Moss's voice could have cut glass. Did you or did you not overrule medical recommendations? I made administrative decisions within my authority. That's a yes. Moss made a note that looked like it carried significant weight. We'll return to that. Captain Brennan, please present your defense. Katherine stood and laid out her case. She presented Fletcher's chart with timestamps showing the code had been running incorrectly for over 3 minutes before she intervened. She presented the mass casualty data showing survival rates that exceeded civilian hospital benchmarks. She presented Tyler Voss's imaging and vital trends, demonstrating that transfer would have resulted in death. And then she presented Delacroix's medical data. Private Delacroix presented with fixed dilated pupils, GCS of 6, bleeding from both ears, and imaging consistent with diffuse axonal injury. The medical literature shows survival rates for this presentation at less than 5%, with meaningful recovery rates near 0. She pulled up comparison studies. We had 4 other critical patients requiring immediate intervention. The decision to provide comfort care rather than futile aggressive treatment allowed us to save 4 lives instead of losing all 5. His fiancée alleges you gave up on him, one of the generals said. His fiancée is grieving. I understand that. But grief doesn't change medical reality. Katherine pulled up the consultation notes. 3 trauma surgeons reviewed his case post-incident. All 3 agreed the triage decision was appropriate given the circumstances and available resources. She presented Gloria Mendez's written statement recanting her initial complaint. She presented Sarah Lynn's testimony about the chest tube placement that had saved a life. She presented Henderson's account of learning proper emergency procedures from watching Katherine work. And finally, she presented the outcome data. Since starting at Stillwater Veterans Hospital 1 week ago, I have been involved in the treatment of 14 critical patients. 13 survived. 1 did not, and that patient was medically unsalvageable based on objective clinical criteria. She looked at the board directly. That's a 93% survival rate on cases that included mass casualty triage, emergency surgery under suboptimal conditions, and multiple patients who were actively coding when I first saw them. I don't claim to be perfect. I claim to be effective. Bam Sommatan. General Moss reviewed the data in silence. Then she looked at Haskell. Mr. Haskell, you've alleged that Captain Brennan represents a risk to patient safety. The data suggests otherwise. Can you explain the discrepancy? Haskell looked like a man watching his career implode in real time. The data doesn't account for the institutional risk. I'm not asking about institutional risk. I'm asking about patient safety. Have any patients been harmed by Captain Brennan's actions? The protocols exist for a reason. Answer the question. No, Haskell admitted. No patients have been harmed. In fact, multiple patients are alive specifically because of her interventions. Yes, but, and you, meanwhile, nearly allowed a general officer to suffer catastrophic injury through administrative cost-cutting measures that overruled medical judgment. Moss closed her folder. I've heard enough. The board deliberated for 7 minutes. Katherine sat in the hallway with Whitmore, not speaking, just waiting. Finally, they were called back in. General Moss stood. This board finds that Captain Katherine Brennan acted appropriately within the scope of emergency medical practice and combat trauma protocols. The allegations of negligence are unfounded. The allegations of protocol violations are noted but considered justifiable given the circumstances and outcomes. Captain Brennan is cleared to return to full clinical duties, effective immediately. Katherine felt something release in her chest, but Moss wasn't finished. Furthermore, this board recommends that Captain Brennan be appointed as Director of Combat Trauma Integration for the entire Fort Dalton Medical Complex, with authority to revise protocols and training programs to incorporate field medicine best practices. She looked at Katherine. This is a promotion, Captain. Do you accept? Katherine stood. Yes, ma'am. Good. Report to Colonel Whitmore tomorrow morning to discuss the scope of your new position. Moss turned to Haskell. Mr. Haskell, you are suspended pending a separate investigation into administrative malpractice. Security will escort you from the premises. Haskell's face went from pale to bright red. This is outrageous. This is accountability. Something you should have considered before cutting corners on a general's medical care. Moss nodded to the security personnel waiting by the door. They escorted Haskell out while he sputtered protests that no one was listening to. The review board adjourned, and Katherine found herself surrounded by people offering congratulations. Marcus was grinning. Sarah Lynn was crying happy tears. Even Gloria Mendez was smiling. Colonel Whitmore pulled Katherine aside. You did it. We did it. No, you did it. I just made sure you had the chance. Whitmore handed her a new folder. This is the preliminary outline for the director position. It's a lot of responsibility. You'll be overseeing trauma training for every physician and nurse in the complex. You'll be revising protocols that haven't been updated since before you deployed. You'll be teaching a new generation how to practice medicine the way you learned it. Katherine opened the folder and scanned the contents. It was overwhelming. It was more authority than she'd ever held. It was exactly what she'd spent 14 years thinking she'd never have again. When do I start? Tomorrow. But first there's someone who wants to see you. Whitmore led her to the ICU, where General Thornton was awake and sitting up in bed, his leg in a cast but his eyes alert. His wife sat beside him. Captain Brennan, Thornton said, his voice rough but strong. They tell me you're the one who kept me alive when I came in. You did most of the work by not dying, sir. He almost smiled. Zhang told me about the stress fractures, told me I'd been walking around on a time bomb for months because someone decided imaging was too expensive. His expression hardened. That's been handled, but I wanted to thank you personally for making sure I survived long enough to deal with it. Just doing my job, sir. No, you were doing your job the way it should be done, the way I wish all military medicine was practiced. He looked at Whitmore. Colonel Whitmore tells me you're taking over trauma integration for the complex. Yes, sir. Good. Fix it. Fix all the things that are broken. Fix the protocols that get people killed because administrators care more about budgets than lives. He extended his hand. That's an order, Captain. Katherine shook it. Yes, sir. She left the ICU feeling lighter than she had in years. The weight of investigation and judgment had lifted, replaced by something that felt dangerously close to hope. Marcus caught up with her in the parking lot. Drinks? I think this deserves celebrating. Rain check. I need to go do something first. She drove to the cemetery on the edge of Clarksville, where James Delacroix had been buried 3 days earlier. She found his grave easily, fresh flowers from the funeral still bright against the turned earth. She stood there for a long time, not praying because she didn't know how, just acknowledging the weight of the decision she'd made, the life she hadn't saved because saving him would have cost others. "I'm sorry," she said quietly to the headstone. "I'm sorry your fiancé is angry. I'm sorry you didn't get more time. I'm sorry I had to make that call." The grave didn't answer, because graves never did, but Katherine felt something settle inside her anyway. Not peace, exactly, just acceptance that some decisions didn't have good options, only less terrible ones. She drove home and found a package waiting at her door. No return address. Inside was a letter and a photograph. The letter was from Tyler Voss's mother. "Captain Brennan, I wanted you to have this photo. It was taken yesterday when Tyler was moved out of ICU. He's recovering well. The doctors say he'll make a full recovery. He wants to meet you when he's strong enough. I know people tried to punish you for saving him. I know they made you question whether you did the right thing. I want you to know that every day Tyler is alive is proof that you did. Thank you for refusing to let my son die. Jennifer Voss." The photograph showed Tyler sitting up in a hospital bed, pale but smiling, giving a weak thumbs up to the camera. Katherine pinned the photo to her refrigerator next to the summons she'd received days earlier. 2 pieces of paper. One representing the system trying to destroy her. One representing the life that system had tried to use as ammunition. She looked at both for a long moment. Then she threw the summons in the trash and kept the photograph. The next morning, she walked into Stillwater Veterans Hospital as Director of Combat Trauma Integration, with an office on the administrative floor and authority to remake military medicine in her own image. Raymond Haskell's office had already been emptied, his nameplate removed, his desk cleared. Katherine walked past it without stopping. She had work to do. But that afternoon, as she was reviewing outdated protocols that needed immediate revision, her phone rang. Unknown number. She almost didn't answer. "Brennan? Captain Brennan, this is Agent Michelle Torres with the Department of Defense Inspector General's office. We're conducting an investigation into administrative practices at Fort Dalton medical facilities, specifically regarding budgetary decisions that may have compromised patient care. We'd like to interview you about your experiences working under Mr. Raymond Haskell's oversight." Katherine leaned back in her chair. "When?" "Tomorrow morning, if possible. We're interviewing multiple staff members. Your testimony could be crucial." "I'll be there." She hung up and looked out her new window at the hospital complex below. Haskell wasn't just suspended, he was being investigated by the Inspector General. That meant potential criminal charges. That meant his career wasn't just over. It was being dismantled with federal thoroughness. She should have felt satisfied. Instead, she felt tired. Her door opened and Colonel Whitmore walked in without knocking. "I just got a call from the IG's office." "So did I." "They're going after Haskell hard. Apparently, Thornton's case wasn't the first time he cut corners on medical care for cost reasons. They found a pattern going back 18 months. Whitmore sat down across from Katherine's desk. "He's going to prison, probably." "Good. Is it?" Katherine looked at her. "You think he doesn't deserve it?" "I think he made bad decisions that hurt people. I also think the system that incentivized those decisions is still in place." Whitmore gestured to the folders on Katherine's desk. "You've got authority now. You can fix protocols, you can retrain staff, but the budgetary pressures that made Haskell cut corners, those aren't going away. Sooner or later, you're going to face the same choices he did." "I'll make different choices. Will you? When you're told you have to cut 20% from your budget and the only place to cut is medical imaging or staffing. When you're told that combat trauma training is too expensive and you need to use cheaper alternatives?" Whitmore's expression was serious. "I'm not trying to discourage you. I'm trying to prepare you. This job isn't just about medicine. It's about fighting the system every single day." Katherine thought about that. About 14 years of being pushed out of medicine because she wouldn't compromise. About coming back and immediately facing investigation for doing things right. "Then I'll keep fighting," she said. Whitmore smiled slightly. "Good, because we're going to need you." She left, and Katherine turned back to the protocols on her desk. But before she could start reading, her phone buzzed with a text from Marcus. "Tyler Voss is asking to see you. Room 347. Thought you'd want to know." Katherine saved her work and headed to the 3rd floor. Tyler was sitting up in bed, still pale, but significantly stronger than the last time she'd seen him unconscious and bleeding. His mother sat in the chair beside him. "Captain Brennan?" he said, his voice rough but steady. "They told me you're the one who saved my life." "I'm one of the people who did, yes. My mom told me you did surgery right there in the ER, that you didn't wait." He looked at her with eyes that were too old for 22. "I heard you got in trouble for it." "That's been resolved?" "Good. Because I wanted to say thank you for not letting me die because of paperwork or whatever." He extended his hand. "I owe you everything." Katherine shook it, feeling the strength returning to his grip. "You don't owe me anything. Just recover and get back to your life." "I will. But I'm going to remember this. When I'm back on duty, when I'm training new soldiers, I'm going to tell them about the nurse who refused to let bureaucracy kill me." He smiled slightly. "That means something." Katherine left the room feeling the weight of responsibility settle across her shoulders like a familiar coat. She'd fought to get back into medicine. She'd survived the attempts to push her out. She'd won authority to change the system. Now she had to actually do it. She went back to her office and worked until midnight, drafting new protocols, revising training requirements, building the foundation for a combat trauma program that would teach the next generation how to save lives the way she'd learned. When she finally went home, exhausted and wired on too much coffee, she found another envelope taped to her door. Inside was a single sheet of paper, a memo printed on official Fort Dalton letterhead. Memorandum for all medical personnel. From Major General David Thornton, Base Commander. Subject: mandatory combat trauma training. Effective immediately, all physicians and nurses assigned to Fort Dalton medical facilities will undergo combat trauma certification training developed and administered by Captain Katherine Brennan, Director of Combat Trauma Integration. This training is non-negotiable and will be conducted in addition to standard medical education requirements. Failure to complete certification will result in reassignment to non-critical care positions. The recent incidents at Stillwater Veterans Hospital have demonstrated significant gaps in our ability to handle mass casualty and high-pressure emergency situations. Captain Brennan's expertise will ensure that all medical personnel are prepared to save lives under any circumstances. This is a priority directive. Compliance is mandatory. Katherine read it twice, then pinned it to her refrigerator next to Tyler Voss's photograph. She'd come back to medicine thinking she'd just be mopping floors and staying invisible. Instead, she was about to remake military trauma care from the ground up. She should have felt overwhelmed. Instead, she felt ready. But at 0200 hours, her phone rang one more time. She answered it half asleep. "Captain Brennan, this is the night supervisor at Stillwater ER. We've got an incoming mass casualty, bus accident on Highway 41, multiple critical injuries, ETA 8 minutes. Colonel Whitmore said to call you immediately." Katherine was already getting dressed. "How many critical?" "Initial report says 12, maybe more." 12 critical patients. The kind of scenario that tested everything she'd been teaching, everything she'd been fighting for. "I'm on my way." She grabbed her keys and headed for the door. And as she drove through the pre-dawn darkness toward the hospital, she felt something she hadn't felt in 14 years. Not just purpose, not just validation, but the absolute certainty that she was exactly where she was supposed to be, doing exactly what she was meant to do. The hospital lights blazed in the distance. Katherine drove faster. The ER was already erupting into controlled chaos when Katherine burst through the doors at 0214 hours. Marcus stood at the center, directing traffic, his face tight with the kind of focus that came from knowing you were about to be overwhelmed. 12 critical, 8 moderate, he said the moment he saw her. Tour bus versus semi-truck, highway speed collision. First ambulance is 90 seconds out. Katherine scanned the department. 4 trauma bays prepped, 6 residents looking terrified, 10 nurses moving with purpose but not enough speed. This was going to be bad. "Clear every non-critical patient to the waiting area," she ordered. "Pull every available physician from the entire hospital. I don't care if they're dermatologists or podiatrists. If they have an MD, I want them here. Get me a status board and assign a scribe to track every patient." Sarah Lynn appeared with a whiteboard and markers. "Already done." The first ambulance screamed into the bay, and paramedics rushed out a gurney carrying a woman in her 60s, unconscious, blood soaking through makeshift bandages. Behind it came another ambulance, then another, then 3 more simultaneously. The flood began. Katherine moved through the chaos like she'd done this 1,000 times before, because she had. Bay 1. Flail chest and pneumothorax, needs immediate tube. Bay 2. Pelvic fracture with internal bleeding, get him to CT then surgery. Bay 3. Head trauma, assess for brain bleed. Bay 4. Multiple extremity fractures but stable, can wait. She triaged with brutal efficiency, making calls in seconds that other physicians would agonize over for minutes. Henderson placed his first chest tube under her supervision and didn't hesitate. Sarah Lynn ran a code on a patient whose heart had stopped mid-transport and brought him back. Marcus coordinated surgical teams with the kind of command presence he'd learned from watching Katherine work. 37 minutes after the first ambulance arrived, they had 12 critical patients stabilized and distributed between the ER, surgery, and ICU. Not one had died. Katherine stood in the hallway at 02:51 hours, her scrubs soaked with blood that belonged to at least 4 different people, watching her team work with a precision they hadn't possessed 2 weeks ago. "That was incredible," a voice said behind her. She turned to find Dr. Lisa Zhang, still in surgical scrubs from an emergency case she'd just finished. "We just processed 12 critical traumas faster than I've ever seen. 0 deaths. That's not luck. That's training. That's you." Zhang handed her a tablet. "I wanted to show you something. I've been tracking ER survival rates since you started here. Look at this data." The graph showed a clear inflection point. Before Katherine's arrival, 72% survival rate on critical trauma cases. After Katherine's arrival, 91%. The difference was staggering. "You've revolutionized how we practice medicine here," Zhang said. "In 2 weeks." Katherine looked at the numbers and felt something she hadn't allowed herself to feel in 14 years. Pride. Not arrogance. Just the quiet satisfaction of knowing she was good at something that mattered. "It's not just me," she said. "It's everyone learning to work differently. It started with you." The morning sun was rising when Katherine finally left the hospital. She drove home, showered the blood and exhaustion away, and fell into bed for exactly 3 hours of sleep before her alarm dragged her back to consciousness. She had a training session to run. At 1400 hours, 47 physicians and nurses assembled in the hospital's largest conference room for the first mandatory combat trauma certification class. Katherine stood at the front with a presentation she'd built from 15 years of experience that couldn't be found in any textbook. "My name is Captain Katherine Brennan," she said. 2 weeks ago, I was mopping floors in this hospital. Today, I'm going to teach you how to save lives the way I learned in places where medicine was practiced with one hand while the other hand held a weapon." She had their attention. For the next 6 hours, she walked them through mass casualty triage, emergency surgical procedures, field improvisation, and the brutal mathematics of deciding who lives when you can't save everyone. She showed them the Foley catheter technique for arterial control. She demonstrated chest tube placement on mannequins until everyone could do it blind. She ran scenario drills that forced them to make impossible decisions in real time. And when Gloria Mendez raised her hand and asked, "How do you live with the ones you can't save?" Katherine gave her the only honest answer she had. "Badly. But you live with it because the alternative is not trying. And not trying means everyone dies." She looked around the room. "You're going to make calls that haunt you. You're going to second-guess decisions. 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 You're going to wonder if you could have done something different. But if you made the best call you could with the information and resources you had, that's all anyone can ask. The room was silent. The patients you save will outnumber the ones you lose, Katherine continued. But you'll remember the losses more. That's part of being human. Don't fight it. Just make sure you learn from it. The training ran for 3 more weeks. Every physician and nurse in the complex cycled through. Katherine taught them everything she knew, holding nothing back, building a trauma program that would outlast her by decades. And in the process, she watched the hospital transform. Residents who'd been hesitant started making confident calls. Nurses who'd followed protocols blindly started thinking critically about patient needs. The entire culture shifted from risk-averse medicine to outcome-focused care. 6 weeks after Katherine had signed that contract, Colonel Whitmore called her to headquarters for a meeting that turned out to include General Thornton, now recovered and walking with only a slight limp, and 2 people Katherine didn't recognize. "Captain Brennan," Thornton said, "I'd like you to meet Colonel Jeffrey Morrison and Dr. Sarah Kensington from the Army Medical Command. They've been reviewing the changes you've implemented here at Fort Dalton." Morrison shook her hand with a grip that suggested he'd read her entire file. "Captain Brennan, we've been studying your trauma program. The survival rate improvements are extraordinary. The training methodology is sound. The cultural shift is exactly what the Army needs." "Thank you, sir." "We'd like to expand it," Dr. Kensington said. "Every military hospital in the continental United States. We want you to develop a standardized combat trauma integration program that can be implemented system-wide." Katherine looked at Whitmore, who was smiling slightly. "That's a significant expansion of responsibility," Katherine said carefully. "It's a promotion to lieutenant colonel, an assignment as the Army's Director of Combat Medical Training," Morrison said. "You'd be based here at Fort Dalton but traveling regularly to other installations. Full authority to revise protocols, retrain staff, and implement your methods across the entire military medical system." It was everything Katherine had never let herself imagine wanting. It was validation on a scale that made her 14 years of exile feel like preparation rather than punishment. "There's one condition," Morrison added. "You'd be required to testify at Raymond Haskell's court-martial. The Inspector General has built a case against him for medical negligence and fraud. Your testimony would be crucial." "When?" "Next month. Are you willing?" Katherine thought about Haskell's smile when he'd tried to destroy her career, about the soldiers who'd nearly died because he'd cut corners, about the system that had allowed him to operate unchecked for years. "Yes," she said, "I'm willing." The court-martial took place on a cold November morning in a military courtroom that felt designed to intimidate. Raymond Haskell sat at the defendant's table looking smaller than Katherine remembered, his expensive suit unable to hide the desperation in his eyes. Katherine took the stand and was sworn in. The prosecutor was a sharp-eyed major named Victoria Reeves, who'd clearly done her homework. "Captain Brennan, can you describe your interactions with the defendant during your employment at Stillwater Veterans Hospital?" Katherine laid it out methodically. Haskell's attempts to restrict her patient contact, his interrogation after she saved Tyler Voss, his role in escalating the investigation designed to end her career, his administrative decisions that had deferred medical imaging for General Thornton. "In your professional opinion," Reeves asked, "did the defendant's cost-cutting measures compromise patient care?" "Yes, directly and significantly." "Can you elaborate?" "General Thornton had stress fractures that should have been identified during routine screening. Mr. Haskell personally denied authorization for imaging that would have caught them. Those fractures progressed to the point where a building collapse nearly killed him. That's not cost management, that's negligence." Haskell's defense attorney tried to challenge her testimony, suggesting she was biased because of the investigation. Katherine shut that down immediately. My bias is toward keeping patients alive. If that conflicts with administrative priorities, the problem isn't my bias. The defense attorney tried a different angle. Captain Brennan, isn't it true that you yourself violated protocols? I violated protocols to save lives. Mr. Haskell violated medical judgment to save money. There's a difference. The courtroom was silent. No further questions, the defense attorney said quietly. The court-martial lasted 3 days. When the verdict came back, guilty on all counts, including criminal negligence, first fraud, fraud, and obstruction, Haskell's face went gray. The sentence was 4 years in federal prison, forfeiture of all government benefits, and permanent prohibition from working in any medical or administrative capacity within the Department of Defense. Katherine watched him being led away in handcuffs and felt nothing, not satisfaction, not vindication, just the quiet acknowledgement that justice, however delayed, had eventually arrived. Outside the courtroom, Mrs. Voss and Tyler, now fully recovered and back on active duty, were waiting. "We wanted to be here," Mrs. Voss said, "to see him face consequences for trying to punish you." "You didn't have to do that." "Yes, we did." Tyler stepped forward. "You saved my life. You fought the system to do it. And now you're changing that system so other people don't have to fight the same battles." He saluted her. "That matters, ma'am." Katherine returned the salute, feeling the weight of responsibility and purpose settle deeper into her bones. 3 months later, she stood in front of 200 military medical professionals at a conference in Washington, D.C., presenting the standardized combat trauma integration program that would reshape how the Army practiced medicine. The presentation covered everything she'd learned and everything she'd taught: triage protocols, emergency procedures, decision-making under pressure, and the cultural shift required to prioritize outcomes over protocols. When she finished, the room stood in applause. A colonel in the front row raised his hand. "Captain Brennan." "Lieutenant Colonel," someone corrected. "Lieutenant Colonel Brennan, you've built something extraordinary here. But I have to ask, how do we maintain this after you're gone? How do we make sure the system doesn't slide back to the way it was?" Katherine had thought about this question for weeks. You don't build it around one person. You build it into the culture. You train the next generation to teach the one after that. You make combat trauma integration a core requirement, not an optional specialty. And you never forget that the point of all this, the protocols, the training, the entire system, is to save lives. The moment you prioritize anything above that, you've failed. The conference ended with commitments from 15 military hospitals to implement the program within 6 months. Katherine flew back to Fort Dalton feeling exhausted and satisfied in equal measure. Colonel Whitmore met her at the airport with news. "General Thornton is being promoted to head the entire military medical division at the Pentagon," Whitmore said as they drove back to base. "He wants you to come with him, Chief of Combat Medical Operations. You'd be setting policy for the entire military medical system." Katherine watched Tennessee countryside roll past the window. "What about Fort Dalton? You'd visit regularly for training oversight, but your primary office would be in Washington." Whitmore glanced at her. "This is the kind of position that defines careers, Kate. Most people would kill for this opportunity. What do you think I should do?" "I think you should ask yourself where you can do the most good." Katherine thought about that question for the entire drive. By the time they reached the base, she had her answer. 2 weeks later, she stood in front of the medical staff at Stillwater Veterans Hospital for a final address before transferring to Washington. "When I started here 4 months ago," she said, "I was a janitor who'd spent 14 years being told I was too aggressive for civilian medicine, too direct, too focused on outcomes instead of protocols." She looked around the room at faces that had become familiar. "You took a chance on someone everyone else had given up on. You learned from someone who'd been invisible, and you built something together that's saving lives across the entire military medical system." Sarah Lynn was crying. Marcus was smiling. Even Gloria Mendez looked emotional. "I'm leaving," Katherine continued. "But the work continues. Every patient you save, every protocol you question, every time you choose outcomes over comfort, that's the legacy we built together." She paused. "Don't let anyone tell you that following your instinct to save lives is wrong. Don't let bureaucracy become more important than the people you serve. And don't ever forget that medicine at its core is about human beings taking care of other human beings." The applause followed her out of the building. She spent her last day at Fort Dalton visiting patients she'd saved. Devin Fletcher, the first soldier whose life she'd preserved, now training new recruits in proper hydration protocols. Tyler Voss, back on active duty and telling everyone about the nurse who'd refused to let him die. General Thornton, recovered and grateful and determined to transform military medicine from the top down. Each conversation reminded her why she'd come back to medicine in the first place. Not for recognition or vindication, but because she was good at keeping people alive and that skill was too valuable to waste mopping floors. On her final evening in Clarksville, Marcus took her to Murphy's bar where they'd had their first real conversation. "To the woman who terrified me, taught me, and made me a better doctor," he said, raising his glass. Katherine clinked hers against his. "To the doctor who listened when it mattered." They drank in comfortable silence for a moment. Then Marcus said, "What you did here, it's going to outlast all of us. 20 years from now, there will be soldiers alive because you taught their doctors how to make the hard calls. That's the goal. It's more than a goal, it's a legacy." He refilled their glasses. "And it started with you walking into a trauma bay and refusing to let someone die because we were following the wrong protocol." Katherine thought about that moment. Standing in the doorway watching Fletcher code, knowing she could save him, choosing to step forward instead of staying invisible. One decision that had changed everything. "I was tired of being invisible," she said quietly. "I was tired of watching people die because I wasn't allowed to use everything I knew, so I stopped asking permission and started doing the work. That's what makes you dangerous to bureaucrats and invaluable to patients." They talked until the bar closed, trading stories about cases they'd worked and lessons they'd learned. When they finally left, Marcus gave her a hug that felt like both goodbye and acknowledgement of something that would continue beyond her departure. "Don't let Washington turn you into one of them," he said. "Not a chance." Katherine drove to her apartment one last time, packed the few belongings she'd accumulated, and took down the photograph of Tyler Voss that had been on her refrigerator for months. She packed it carefully, a reminder of why the work mattered. The next morning, she drove to Washington, D.C. with everything she owned in the trunk of her car and a career ahead of her that 14 years ago she'd thought was dead forever. She reported to the Pentagon on a Monday morning wearing her uniform with new oak leaves on the collar, Lieutenant Colonel Katherine Brennan, Chief of Combat Medical Operations. Her office overlooked the Potomac and came with a staff of 6 and authority to reshape military medicine across all branches of service. General Thornton met her on her first day with a stack of folders and a smile. "Ready to change how we save lives?" "Always." They spent the next 6 months building programs, revising protocols, and fighting bureaucratic resistance from people who thought the old ways were good enough. Katherine won most of those fights through a combination of data, determination, and the kind of direct communication that made administrators uncomfortable and soldiers respect her. A year after leaving Stillwater Veterans Hospital, she received a letter from Sarah Lynn. The young nurse had been promoted to head of emergency services and was implementing trauma training for civilian hospitals in Tennessee. The program she'd learned from Katherine was spreading beyond military medicine into the broader medical community. 2 years later, Katherine stood in front of Congress testifying about military medical readiness. She presented survival rate data that showed dramatic improvements. She advocated for increased funding for combat trauma training. And when a senator asked if the improvements were sustainable or just a temporary spike, she looked him directly in the eye. "The improvements are sustainable because we changed the culture, not just the protocols. We taught an entire generation of military medical professionals that saving lives matters more than following rules that don't work. That's not temporary. That's transformation." The funding was approved. 5 years after mopping floors at Stillwater Veterans Hospital, Lieutenant Colonel Katherine Brennan had revolutionized military trauma care, trained over 3,000 medical professionals, and contributed to survival rate improvements that saved an estimated 2,000 lives annually. She never forgot where she started. Every year on the anniversary of her first day at Stillwater, she visited Fort Dalton. She taught classes to new residents. She walked through the ER where she'd saved Fletcher and Voss and countless others. She visited the janitor's closet where she'd stored her equipment when everyone thought she was just cleaning staff. On her 5th anniversary visit, she found a plaque mounted on the wall outside the ER. In honor of Lieutenant Colonel Katherine Brennan, whose courage to act when others hesitated revolutionized military trauma care and saved countless lives. She proved that expertise matters more than titles, outcomes matter more than protocols, and one person refusing to stay invisible can change an entire system. Katherine stood in front of that plaque for a long time, reading words that would outlast her, thinking about the journey from invisible to invaluable. She thought about the soldiers alive because she'd refused to let bureaucracy kill them, about the medical professionals who'd learned to trust their instincts because she'd shown them how, about the system she'd helped transform from the inside out. And she thought about the 67-year-old woman who'd walked into that ER 4 months into her custodian job and made a choice to save a life instead of staying in her lane. That woman had been tired of being invisible. That woman had been right. Katherine touched the plaque once, then walked back into the hospital where new residents were practicing the techniques she'd taught, where protocols she'd written were saving lives, where her legacy lived in every patient who walked out alive because someone had learned to make the hard calls. She was 69 years old now, still working, still teaching, still fighting the system when it needed fighting and building it when it needed building. And she was finally, completely, unapologetically visible. Not because someone had given her permission, but because she'd taken it. The ER doors opened and a young resident ran out, panic in her eyes. "Colonel Brennan, we have a situation, multiple trauma, helicopter crash, 3 critical." Katherine was already moving. "Show me." Because some things never changed. The work continued. The lives mattered. And Katherine Brennan, former combat nurse, former janitor, current chief of military medical operations, was exactly where she belonged, doing exactly what she was born to do, saving lives that everyone else thought couldn't be saved, one impossible decision at a time.